My Lords, the virtual proceedings of the debate in the name of Baroness Wheeler will now commence. This is a time-limited debate. I will first call Baroness Wheeler in the usual way. The question will then be put. Then I will call each speaker on the list the usual way. Please ensure that you unmute your microphone prior to speaking. Your microphone will be returned to mute when you finish speaking. In accordance with the guidance agreed by the Procedure Committee, if your name is not listed, it is not possible to take part in proceedings. Before I call Baroness Wheeler, I'll call upon the Chief Whip to speak briefly. Chief Whip.
Thank you, Chair. I just wanted quickly to say to noble lords that this is a time-limited debate. We've probably heard all this before, but I need to reiterate it. And it will finish after 3 hours, and the House agreed that yesterday. So please, can I urge noble lords to stick strictly to the speaking limit, not only out of courtesy to other noble lords who wish to speak, but also because any overrun will have to be taken from the Minister's allocation. He will therefore have less time to answer noble lords' questions. I know it's difficult, but I'd be very grateful if noble lords could stick to that. Thank you.
Motion for debate, COVID-19 social care, Baroness Wheeler.
My Lords, can I start today's important debate in the way that I know noble lords from across the House will want me to, by recording our deep sadness and regret for the loss of 19,609 people who across the UK are known to have died from this terrible disease in hospitals, care homes and in their own homes. We know that the true figure, due to delays in reporting, is likely to be considerably higher. Our sympathy and thoughts are with their families, friends and the people who will have cared for them, relatives, NHS and social care and community care staff. As a dedicated manager in a small Nottinghamshire home where deaths to suspected Covid-19 had reached a total of 9 residents, a third of the people under her care put it, she thought of them as family. It's just soul destroying, she said. We have deaths normally, but they are good deaths with their family around them. As the weeks go on, Parliament will rightly focus on the continuing fight across health and social care to halt the spread of the disease and on the care of patients and staff currently suffering from it. Staff across these services have been putting their lives on the line, and sadly, we see reports that over 100 have now died as a result of this dedication. Our thoughts are also with their families, friends and colleagues, and of course, we are forever grateful to all our NHS and social care staff who are working tirelessly to help us deal with the crisis. Today's debate is the time to take a hard look at the short and long-term impact of COVID-19 on social care. It's vital to continue to step up the pressure on the government to deliver on what has too often, sadly, been woefully inadequate and seriously belated promises and actions on social care. But we also need to take stock and identify what the current social care response to this pandemic tells us about how a similar crisis must be handled in the future and how in the years to come social care is organised, funded, delivered and staffed and properly mainstreamed into our health and social care system. We know there's widespread frustration and dismay in the social care sector that once again it has been a Plan B afterthought. The government's social care plan was finally published last week, 5 weeks after the plan for the NHS. From the outset, Labour has made it clear that we want the government to succeed in dealing with this huge crisis, and we have pledged to work constructively with them. But we have also made clear that we will challenge where there are mistakes that can be put right, where we think something is not happening that needs to, and we will closely scrutinise the decisions made. It was in this spirit of constructive engagement that we fully cooperated with the COVID-19 bill before the recess, and in which we want today's debate to be framed. In the same vein, we have repeatedly called for urgent action on the supply and delivery of personal protection equipment and for the testing of all NHS and social care staff for the virus and proposing ways which will help turn the situation round. Last weekend's Public Health England announcement changing guidelines on the need for full-length protective gowns for doctors and nurses treating COVID-19 patients because supplies were due to run out has just added to the despair staff in the NHS and social care feel over not having the essential equipment they need to keep patients and themselves safe. being told to reuse equipment or not to waste it, and stop-start big announcements of targets or shipments on their way just decreases morale still further and makes the situation even worse. On care homes and domiciliary services, even the most ardent cheerleaders for the government, such as the Daily Telegraph and Mail, have recognised and been highly critical of the chaos surrounding testing and PPE. Key charities, the Alzheimer's Society, Marie Curie, Care England and Age UK have talked about the devastation in the care system with the lack of testing and PPE, meaning staff are putting their lives at risk while also carrying the virus to vulnerable groups. ADAS, the Association of Directors of Adult Social Services, on 16th of April summed up the PPE situation as shambolic, with early PPE drops in the care sector paltry and more recent deliverers haphazard, with confusion and additional workload resulting from the mixed messages and poor communications between the two key government departments, local government and health. We know that the care managers have desperately been driving miles around trying to buy masks, gloves, gowns and other vital PPE, trying to halt the spread of disease in care homes, with many staff making their own masks or having to use the same masks and other items all day. All this with huge extra costs involved for care homes. The care provider MHA, for example, had to purchase 200,000 masks at 5 times the usual cost. Full PPE is just as important to staff in care homes nursing residents with suspected COVID-19 as it is in the hospital and NHS care settings. It's also vital if families are to be allowed into care homes to be with their very ill or dying loved ones. The recent change in government guidance on this is very welcome, but can only happen if homes have full PPE testing and other important procedures in place to protect staff, residents and their relatives. Can the Minister now provide an exact date by which all those working in social care will have the continual, adequate supply of PPE of the required standard so they can do their jobs in safety? Care homes from the outset have underlined that patients could only be treated from hospital after they have been COVID-19 tested, but this essential requirement was not in the original guidance, has not been followed in many areas. Can the Minister confirm that new guidance will be issued on this very basic requirement with accompanying levels of PPE? Will care homes and care home providers be refunded the full and crippling extra costs for PPE, including covering the spiralling prices that the shortages have led to? We know that the residential care is in precarious financial state, with many homes facing closure, and that the UK Home Care Association fears that financial pressures resulting from COVID-19 could force a significant number of the UK's 8,000 home care providers to close within weeks.
Great, thank you.
On funding, the government has rightly said that the NHS will get whatever resources it needs to deal with the COVID-19 pandemic. Can the Minister categorically state today that this also applies to social care? For social care, this means not just covering PPE extra costs, but the extra costs of staffing in care homes and home care to pay for increased staff sickness and vacancies and other care costs. On testing, Labour has strongly stressed the urgent need for testing of patients and staff in care homes and for a clear and detailed plan on how this is to be actioned and achieved. Not testing, for example, new or returning residents risk contaminating care homes where elderly and vulnerable people are supposed to be shielded, a policy described by home care providers as importing deaths into care homes. New testing for all residents for symptoms and all those being transferred to homes has been announced. Can the Noble Lord the Minister tell the House how and where those who have tested positively will be effectively isolated? Will extra resources be provided to care homes for this? Since the lockdown began, care homes have sealed themselves banning visitors and introducing social distancing for staff and residents. But caring for COVID-19 residents is staff intensive, requiring barrier nursing of residents in single rooms. In home care, widely acknowledged to be the most fragile part of the social care system, COVID-19 presents a particular challenge for care workers who visit multiple clients a day and every day in their homes, and routine testing and access to PPE are essential. With no centralised records of the numbers of people needing support, there are fears that people might be left without care or even dying alone at home without care. What action has the government taken to prevent this happening? A detailed plan is also needed about how and when the government will test all the 1.4 million frontline social care staff, to include domiciliary home care staff and staff working as personal assistants, doing a vital job of looking after disabled people in their homes, disabled and mentally ill people in their homes, through direct payments. Only 505 social care staff have so far been tested. How is this number going to be escalated to meet the needs? Can testing centres cope with the proposed volume of testing? What plans are there for providing testing arrangements locally for staff who can't drive or don't have the time to drive the often very long distances involved? What will the criteria be for social care staff being eligible, for example, if they don't have symptoms but have been in contact with someone who has tested positive for COVID-19? My Lords, under the emergency COVID-19 bill, there was deep consternation and fear across the House that the temporary suspension of rights under the 2004 Care Act on care and care assessments, eligibility and care packages will result in care standards being lowered or even ended, putting disabled and vulnerable adults and children at risk. As a carer of a 75-year-old stroke recoverer, I know how much carers depend on vital social care support in the home and in the community, and many carers have spoken to me about their concerns. Can the Minister tell the House what national monitoring arrangements and oversight mechanisms have been put in place to keep this situation under close review? Does he have any national data on the number of councils that have had to revise existing care packages and arrangements in the light of COVID-19? For the future, Labour's new leader, Sir Keir Starmer, this weekend called for a new settlement for social care, an ambition for society that puts dignity and respect at the heart of how we care for the most vulnerable and how we properly reward our key health and social care workers and repay the debt we owe to all those who sacrificed so much during the COVID-19 crisis. We must learn from the current crisis on how social care should be valued, resourced and delivered in the future. Under COVID-19, the broken care system is at least getting some overdue attention it needs and deserves. Surely the public can't be in any doubt any longer about how essential it is. Treating social care needs as secondary to NHS needs has almost become a default system for the sector. So often in the past, the current crisis sees yet again stakeholders, staff and charities warning the government that older people's lives are not worthless, care home staff are not second-class carers. This is a reality of how the sector has had to struggle for recognition and funding. I hope the Noble Lords will firstly reassure the House that the government now recognises that we must have proper planning for pandemics on the scale of COVID-19, a system that goes across health and social care for the future. Clear responsibilities must be given to the key NHS social care and public health lead agencies, and as used to happen in the past, sufficient stockpiles of protection and testing equipment regularly monitored and updated. We've now seen all too well that this isn't money wasted to be first in line for austerity cuts or dumping in favour of a no-deal Brexit planning. The integrated data across health and social care, which accurately reflects what's happening on the ground, is a key requirement for any future plan. Secondly, we have to address the overall health and social care structure, the commissioning, duplication and bureaucracy of the Lansley NHS structure and the fragmented provider structure of residential home and community care and precarious method of funding have to be addressed if we were ever to have fully integrated care. As we have learned from this pandemic, public health provision and planning needs to be across health and social care. Thirdly, local authorities must be properly resourced for the social care duties they undertake under the Care Act. We know there have been £7.7 billion cut from council budgets since 2010. Of the £2.9 billion welcome extra funding for councils for COVID-19, only 10% of the initial £1.6 billion was allocated to social care. The additional money, however welcome, allocated to a desperately underfunded service in crisis before the pandemic, barely touches the crisis that social care faces. Fourthly, we must treat staff with the respect as the professionals they are and that they deserve. Home care and domiciliary pay rates do not match those of NHS staff, who themselves do not receive the pay which reflects the vital work they do. 1.4 million people work in the social care sector. Care workers are often employed by agencies on 0 hours contract, hardly surprising that even before the COVID-19 outbreak, there are 122,000 care worker vacancies and that annual turnover of staff is 30%. More than a third of care home staff are currently believed to be off work or self-isolating. Finally, future social care planning has to include basic personal care support in people's homes for those in need, including the 1.4 million older people that Age UK has identified who need help with washing, dressing and going to the toilet that they currently just don't get. This is why Labour strongly supports the National Care Service, and we know that the Lords' own Economic Committee rightly supports this too. My Lords, I'm so grateful that so many noble Lords are contributing today, covering many issues I just haven't had time to cover. In conclusion, the coronavirus pandemic has brought the deep crisis in social care to the fore. We no longer live in a society where social care can be delivered on a shoestring budget under a system routinely starved of funding and relying on periodic cash boosts to prop it up and save it from total collapse, and where care workers are overworked, undervalued and underpaid. In other words, we can't just applaud the frontline workers every Thursday and then go back to business as usual. I move the motion.
The question is that this motion be agreed to. Lord Astor of Hever.
My Lords, the Coronavirus Act 2020 has relaxed the duties and responsibilities of local authorities to provide care and support to a revised minimum level, which would solely meet a person's need measured according to their human rights, a very low bar indeed in this context. In the immediate short term, local authorities have other priorities. Even in better times, it is a struggle to fund social care, and it is vital that we do not lose the hard-won legal support structure, ensuring that correct social care is assessed and delivered to the neediest in society. Will the government undertake to repeal the social care provisions of the Act and reinstate the pre-existing law and regulations at the earliest opportunity? The government has announced £1.6 billion worth of additional aid to local authorities to support social care. The delivery of this money to hard-pressed providers has not been smooth, and I would urge the government to press local authorities to use this money as required by the government. Without this financial support, many providers will fail, leading to an intense crisis in domiciliary support and in homes. Will the government apply the greatest possible pressure on local authorities to pass the additional funding on to providers of social care? And would the government consider ring-fencing some of this money? Turning to specific cases, many hard-pressed families have family members who require significant support. The strain on the mental health of the family members acting as carers frequently results in provision for respite from their duties from a few nights at specified intervals. The requirements of social isolation and quarantine means that they no longer receive the respite needed to survive. They are now locked into a cycle of support without any break and with no additional provision forthcoming to help them in any way. And in the current emergency, will the government encourage both local government and social care provision under the NHS to look carefully at the needs of those often forgotten and unsung family carers who are already saving the government millions in care costs?
Lord Blunkett. Lord Blunkett is not responding. Baroness Tyler of Enfield.
My Lords, I would like to thank Baroness Wheeler for securing this vitally important debate. As the terrible and ever-rising death toll
Baroness Tyler of Enfield is also not responding. Baroness Gray Thompson.
I'm here. David Blunkett's here.
Lord Blunkett, then, Baroness Gray Thompson, could you please stand fast?
I'm here
Lord
as well.
I know, but Lord Blunkett had a earlier on had a problem, but he's now available, and I call Lord Blunkett.
Firstly, could I declare interest in the register, including as a Vice President of the RNIB and Alzheimer's Society? I'm really addressing the Lords today with the experience I had as 4 years chairing the Social Services Committee in the City of Sheffield and as Shadow Secretary of State for Health in the 1990s. I want to address the future rather than the present, as I know other people will certainly be doing that. And I'd like to endorse everything that Baroness Wheeler and Lord Astor have said and called for this afternoon. When Baroness Gray-Thompson spoke on the 24th of March, she did so from the heart in relation to the immediate situation facing people with disabilities. I want to take a look at what will happen in the months ahead if we don't get the exit strategy right. We're all aware that social services have been massively underfunded for very many years, and the pressures and demands on the service have been way beyond what could actually be met by local authorities and private providers. That is why it's really important that when we come out of the worst of the lockdown, we actually have the continuing resource to be able to sustain both domiciliary care as well as residential. I think it's really important that we also sustain the volunteers who have made themselves available, both the 750,000 nationally and those with mutual aid at community level. And I hope with data protection in mind, we might be able to keep a register and keep them involved for the future. I hope the government will consider that. The real issue that I wanted to address this afternoon is the question of what happens if the lockdown continues for a substantial period of time. Some people, sometimes irresponsibly in my view, have started to talk about months rather than weeks in terms of a gradual release of the isolation, crucial for mental health, crucial for people with disabilities, but crucial to avoid a situation where we end up with more people needing support in the years ahead because they've deteriorated over the period of the lockdown. I hope, therefore, that the government will consider setting up a separate body to SAGE, which will give advice on the way in which the dragon that we are slaying in relation to the pandemic will not be replaced by an equal beast, to use a metaphor on St. George's Day, which will actually lead to substantial additional pressures on the system in years to come as people who were not feeling aged, who were not feeling isolated, who were not in distress and full of anxiety, find that they now are. In other words, let us not, with the best intentions of today, make a major problem for tomorrow. Thank you.
Baroness Tyler of Enfield.
I would like to thank Baroness Wheeler for securing this vitally important debate. As the terrible and ever rising death toll in care homes has so vividly shown, the social care sector, so long underfunded and neglected by politicians and policymakers, finds itself at the front line of this cruel pandemic. My Lords, the severity of the challenge faced in care homes and other community settings is impossible to overstate. In short, care homes providing personal and close contact care need urgent access to reliable and ongoing supplies of protective equipment to protect residents and staff, rapid and accessible testing, and far greater support with funding and equipment on an equal footing with the NHS. If this pandemic has proved one thing, it is that health and social care are inextricably linked and cannot be treated differently. The National Care Forum have called on the government to form a ring of steel around care homes. But what's it like at the moment? I've spent the last couple of days talking to various social care leaders running frontline social care services, and it's been a humbling experience to hear what's going on. Stark messages include how the rhetoric from government is hard to hear when the reality is so different, the confusing, contradictory and constantly changing nature of guidance being issued by government and other bodies, the daily struggle to secure protective equipment, with government supplies sometimes being diverted to NHS facilities and homes having to source their own supplies at extortionate prices, staff shortages running at 25%, alongside existing high vacancy levels requiring the hiring of agency staff, which raises the risk of transmission, a serious shortage of nurses in homes and great difficulty recruiting as nurses are deployed into the acute sector, and testing arrangements which show little understanding of how the sector works, with care workers who don't have a car being asked to drive to centres many miles away at times that don't fit with their shift patterns. Patients being sent from hospitals into care homes without testing, much needed financial resources from government not reaching the front line, GPs no longer coming into care homes to verify deaths, leaving such tasks to some of the lowest paid staff, and care workers feeling insecure and anxious, left in charge of clinical details. Based on these conversations, can I ask the Minister, why are care homes having to pay VAT on protective equipment when the NHS doesn't? And what urgent steps the government is going to take to put them on an equal footing? What measures is it taking to ensure that some registered nurses in the newly returning workforce are being deployed to care homes who desperately need them? And when will the newly established volunteer scheme be used to help care homes? And finally, when will government's visa exemptions for NHS nurses be extended to those working in the social care sector? My Lords, when this terrible tragedy subsides, long overdue and fundamental reform of social care must be a top priority. A national health and social care system means just that, a fully integrated service, properly funded, run on an equal basis. So we are no longer, as one social care professional put it to me, simply an afterthought at the back of the queue.
Baroness Gray-Thompson.
My Lords, I draw your attention to my register of interest in that I'm Vice President of the LGA. My Lords, the Care and Support Alliance has reported thousands of people getting in touch with their members over this very issue. The questions I raised at the second reading of the coronavirus bill are still valid, and I'll be writing to the Minister because of the 3-minute time limit we have today. So to help proceedings, I have 9 questions. There is still a lack of adequate PPE for disabled people and their carers. One young disabled woman reported that she was verbally abused for not having adequate PPE available, even though it's difficult to obtain. Another young woman who was struggling with PA support was told she should just go and live in a care home. Question 1, now care death homes are being reported, is HMG changing its strategy for this sector? A really serious danger is that some disabled people might be forced to move back to family, which could be toxic or abusive, because that would appear safer than a care home. Question 2, for transparency, will HMG report deaths in the community so that the true overall death figure is accurate? If not, why not? Question 3, HMG said that the target delivery was 100,000 coronavirus tests by the end of April. Is this on target, and how many more need to be done? Was this a logistics aim or a medical aim? Will the Minister confirm disabled people will not be excluded from testing? Question 4, will HMG review carers allowance, and unpaid carers are also in a precarious position? 5, will HMG urgently review the guidance on direct payments? It's confusing, and families are at breaking point trying to manage working from home. However, my Lords, my biggest concern is that, as I understand it, 8 areas have switched on the Care Act appeasements. I can find the names of 6. They're Sunderland, Middlesbrough, Warwickshire, Staffordshire, Birmingham and Solihull. Question 6, as a matter of urgency, could the Minister confirm that these 6 are correct? It was also reported in the Law Society Gazette this morning, which has now been removed, that the other 2 are Croydon and Hertfordshire, although Hertfordshire have said they've not triggered any easement. This is very confusing for everybody. So can the Minister confirm which areas have triggered easement? Question 7, could they explain how these areas have apparently reached crisis point such that they can't carry out their duties to disabled people, but nowhere else has? Or are there more than 8? Question 8, how are disabled people expected to get advice if they don't know what law their local area is applying? And finally, my Lord, question 9, does the Noble Lord the Minister accept that His Majesty's Government should publish on a very regular basis the full list of areas that have switched on Care Act easements? And if they're not prepared to do so, explain why not. Thank you.
Baroness Warwick of Undercliff.
My Lords, I congratulate my noble friend on calling this vital debate at a very difficult time in our history, and I thank her for all the work she's done on this issue. I declare an interest as the chair of the National Housing Federation, the trade body that represents not-for-profit housing associations in England. My Lords, the spread of this virus is indiscriminate, but its impact on our society's most vulnerable people is pernicious. And here I want to pay tribute to all those who, despite the risks to themselves and their families, are still faithfully working to help those in care. Many of us have reason to be grateful to them and their families for their sacrifice. Like many, I found the number of fatalities in care homes both alarming and distressing. Earlier this month, reported deaths from Covid-19 in care homes quadrupled in the space of a week, and we know this isn't the full picture. My Lords, we need a clear plan in place to reverse this trend. 50,000 care home spaces in England are provided by not-for-profit providers like housing associations. They also provide 76% of all supported specialist and sheltered housing schemes for older people, people with disability, and people with mental health needs. They support people in homelessness, hostels, and domestic abuse refuges. All of these are vital components in our social care system beyond those services regulated by the CQC. And all of these care settings are currently grappling with the enormous challenges that this virus brings. We should not let them be forgotten or neglected. Accessing PPE is a significant ongoing challenge for all these workers who've daily contact with those people who are being shielded. And quite rightly prioritising NHS staff, it must be extended to others most at risk. I welcome recent government guidance on testing in the community. I know housing associations hope that it will stimulate greater availability of tests for their frontline staff. Those working with our older and more vulnerable population need to know that going to work will not put their safety and residents' safety at risk. We owe it to people working in care settings to value and publicise their work and to put it on a financially secure footing now and in the future. The statistics and result of the virus on those in care homes must be a wake-up call to take action on the questions about our social care system that have dogged our country for so long. Housing associations are already mobilising for this. My Lords, a root and branch review of how we provide care to the most vulnerable in society has never been more critical. Will the Minister commit to it now? Without it, we remain as unprepared for any future health crisis as we were for Covid-19.
Baroness Wheeler.
I join other noble lords in commending and thanking the care sector for all they do for those in their care, both in care homes and in the community. And I'm happy to echo Baroness Wheeler's opening remarks and thank her for instigating this debate. The majority of these care providers are private organisations, not-for-profit organisations or charities, and their income has remained pretty well constant throughout this crisis, but their costs have soared for replacement care workers, from agency or banks to cover staff illness, and as we heard in questions today, the new unanticipated costs of PPE. So can the Minister confirm that no provider of care will be allowed to fail in this crisis for lack of funding to cover these and other costs? My comments will largely be about people with learning disability and others who found themselves with DNR on their records. My Lords, we're fortunate to live in a country where life is universally valued. For the last month or so, we've seen this play out on the news as daily we witness the efforts of our NHS and care workers struggling to save those who are in their care. Their compassion brings us to tears and to our doorsteps on a Tuesday evening. Old, young, fit or frail, it matters not. But this Covid-19 crisis has seen parents of autistic adult children receive letters from their GP practices suggesting these children should have a Do Not Resuscitate or DNR label added to their notes. So I applaud the Care Quality Commission for its condemnation of GPs across the country for categorising people who receive care in community settings as not requiring resuscitation should they fall ill with coronavirus. Let us be clear, my Lords, a DNR is a clinical decision that in perfect circumstances involves the doctor, patient and family. NICE recommends clinicians use the clinical frailty scale when considering patients for intensive care. It is designed to prioritise those most likely to recover from the virus. But the clinical frailty scale is not suitable for use with people who have learning disabilities, nor for people with other kinds of disabilities or conditions that affect their ability to do things independently. My lords, whatever the circumstances, life or death should not depend on your age, your disability, who provides your care, or where you live. So I wonder whether the Minister could tell me, does he agree with me? And could he please persuade the department to put this message out to all providers, both in care or in health? And perhaps we could ensure that it's part of the promised Green Paper.
Baroness Masham of Ilton.
No longer muted. My lords, can you hear me?
Yes.
My lords, I thank the noble Baroness Wheeler, for securing this debate. With so many people speaking, it shows how important this extraordinary virus is. My lords, I have had many disabled people contact me. One was the wife of a man who had multiple neurological problems. His conditions, because he had several, were not on the list of high risk. He was told he should work, even though he is vulnerable. My lords, Her Royal Highness Princess Royal is the patron of the Spinal Injuries Association, and I am the president. Princess Anne has written a personal, encouraging letter. I quote from one sentence: "I want to let you know that you are not forgotten." My lords, we do not understand why spinal injury people who can be very vulnerable are no longer on this most vulnerable list. One tetraplegic died because he was denied ventilation. Many disabled people live in their own homes and have live-in carers. With Brexit and then coronavirus following, it has become very difficult getting helpers. Will the government undertake and realize this predicament and relax immigration for people coming from Europe, as they make very good carers? This is for not only people living in their own homes, it's for hospitals and care homes. We really are at risk. Thank you.
Baroness Verma.
Thank you, Lord Speaker. My Lords, I'd like to refer to my interests in the register as a provider of social care. And can I start by thanking Baroness Wheeler for instigating this really, really critically important debate. And I think everything she has said today is really, really the facts on the ground. But going forward, we are a sector that was already in crisis before COVID-19. And I can assure all noble lords, the amount of pressures and the anxieties being felt, not just by the people who are providing the management of it all, but those that are delivering care within the home care sector and the home care home sector, is so high at this moment in time. I have only praise that I can't quantify in putting out to all of those that are actually delivering at this moment in time. It is heartbreaking to sometimes see my care staff who are so frightened of then going back home, hoping that they aren't taking something back home with them to their families. But my lords, I want to focus my comments and questions on invisible disabilities like mental health, dementia, Alzheimer's, anxiety, and all of those disabilities that most people cannot see, but our systems are there to provide support for those people. And over the last few weeks, it has been heartbreaking that a lot of our clients, our service users, cannot visit day centres, cannot go out. The only people they have contact with are the care workers. And my thoughts are to the Minister, would he consider, as other noble lords have said, the thousands of volunteers that have signed up to help, if only they could be part of the social activity of isolated people within their homes, because anxiety, mental health, dementia is not going to suddenly get better once the crisis is over. These are long-term issues that need to be dealt with. And as a provider, my lords, we are facing huge bills for PPE. We want the government to treat us like the NHS and let's get the VAT removed for us as providers. And the extra 1.6 billion, although it's welcome, I would like to reiterate, like other noble lords, it is nowhere near enough in the costs that providers are having to face at this moment in time. And my worry, my serious worry, is that we will end up seeing a crisis emerging from another crisis that was on a sector that was already struggling to get people to work in a very highly skilled but extremely poorly paid part of the workforce. And I would urge my noble friend to respond positively to my ask and get more funding in and have it ring-fenced so it goes to the social care sector.
Lord Hayne.
My lords, I should declare that my wife is a board member of 2 care providers. Even before this pandemic hit, social care in this country was, with a bigger workforce than the NHS, was in crisis. During the past decade of austerity, over 7.7 billion has been cut from adult social care budgets, leaving 122,000 vacancies, or 9% of care roles unfilled, and many providers struggling to remain financially viable, despite the fact that they have increased needs. In 2017, the Care and Support Alliance highlighted that 29% of disabled people had seen a reduction in their package of care, leaving many without adequate personal care, preventing disabled people from leaving the house, attending work, and fully 25% without food. Covid-19 has massively accentuated the social care crisis, with funding pressures spiraling out of control, especially for charities and smaller care providers, as they've been hit by rising operational costs, staff shortages, and the collapse of fundraising overnight. Staff shortages, my lords, are severe. Between 10% and 25% of care staff are self-isolating, forcing more costly agency workers to be hired. Costs of sourcing PPE are soaring, with government rhetoric to increase supply not matched by reality. Care providers report that the Clipper service is not delivering, with the government's 4 main suppliers of PPE all out of stock. Carers have had to source their own PPE, often at inflated prices. The charity Leonard Cheshire is spending an additional £250,000 a month sourcing PPE like gloves and face masks. A South Wales care provider, £100,000 extra monthly. And they're all struggling to find specialist PPE like gowns and face masks due to national shortages, placing 4,700 Leonard Cheshire care staff and their 3,000 disabled residents at risk of infection. Care homes and care organisations are always on the edge of viability, immeasurably worsened because people are now reluctant to move into care homes, just as they are to visit A&E for fear of infection, and managers are reluctant to take them in without proper testing. Every empty bed pushes a care home closer to financial collapse. NHS beds become clogged up, and the additional 1.6 billion pledged to fund local authorities is nothing like enough to guarantee that social care can be sustained throughout the pandemic. The government must act quickly to deliver PPE to the 1.5 million social care workers and rapidly increase access to testing. Then it must provide many billions more of adequate funding to ensure quality care for all. Instead of his shamelessly Trumpian attack on the Welsh Government yesterday, Dominic Raab should heed the latest Treasury statistics showing that public spending on social services for older people in Wales is 48% higher per head of the population than in England. Surely if the UK government had followed the Welsh model of prioritising elderly care investment despite major austerity cuts, the truly terrible COVID-19 crisis in care homes could have been alleviated.
Baroness Barker.
My Lords, I thank Baroness Wheeler for this opportunity to hold the government to account. My Lords, I return to a point that I made during the emergency legislation debate, and that is the difference between the NHS and local government. The NHS is a top-down, centrally driven organisation which remarkably almost overnight was able to change everything it did and to focus on the medical emergency from the pandemic. Local government is much more complicated, much more fragmented, and is dealing with a care system which was already broken and is having to keep other vital public services going at the same time. So the government needs to treat them differently. Government is issuing detailed guidance for social care, but nearly every day it changes. And what local government and care providers really need at the moment are clear messages delivered in good time and quick responses when things don't work. For example, the testing sites are just not working in the way that was envisaged. So the government should start now to work with local authorities and local resilience forums to plan and roll out a series of testing sites which are accessible, which mean that people can get to them and we can get the numbers for testing up. 750,000 people applied to volunteer with the NHS, and the NHS has never managed volunteers terribly well. Most of them are not being used. So those people who signed up to Good Sam really need a clear message that they can and they should volunteer via the local resilience forums and local authorities. And the NHS needs to start telling local authorities how many people in their area are signed up to Good Sam and who they are, so that they can get on to that job of supporting vulnerable people in the community. On the 18th of April, the Secretary of State announced further 1.6 billion for funding for local government. And he described people working in local government as the unsung heroes at the forefront of the national effort to beat the virus. 3.2 billion will not cover the costs which local authorities will have incurred during these 4 months, nor their loss of income. The pandemic will have a much longer tail for local government than it has done for the NHS. So will the government now start to plan the transfer of funds and other resources from acute health services to local authorities and communities, which will be struggling to deal with the effects of this virus long after the NHS has completed the majority of its work?
Lord Alston of Liverpool.
My Lords, I too thank Lady Wheeler for initiating today's important debate. Earlier this month, I drew the Minister's attention to the appalling death toll at Wavertree's Oak Springs Care Home in Liverpool, where 16 people have died. For grieving loved ones and for the people who care for them, deaths in care homes are diminished when out of sight means out of mind. Even with a carer at your deathbed, it is a devastating and harrowing way to end your life in isolation. Surely, my Lords, more can be done to enable loved ones to visit and, where requested, to provide spiritual accompaniment, the sacraments and ministry, and for the skills of hospices and palliative care to be urgently made more widely available. My Lords, carers have expressed concern to me, a concern which I share, that the government has said in relation to the virus, let it run hot. Is that still being said? And who authorised letters sent by GPs to care homes stating that their residents, including adults with learning disabilities, would be unlikely to be offered ventilation? It is impossible to say in advance that such treatment would not be appropriate or beneficial. My Lords, as we heard from Lady Warwick, deaths quadrupled in care homes last week. The Financial Times yesterday estimated that some 10,000 have died of coronavirus in our care homes. And this morning in the Daily Telegraph, they said that they believe the rate of attrition is about 400 every day. We've also learned that half of deaths in Europe have been in care homes. But meanwhile, only 25% of care workers have been able to access tests. Pursuing a point made just a moment ago by Lady Barker, when will all care homes have adequate supplies of PPE and their staff routinely and regularly tested for coronavirus? Without such tests, carers are having to self-isolate because they develop symptoms and don't want to risk killing the people that they care for. No one can say we didn't know what we were facing. Weeks ago in Italy, they said that the elderly in care were facing a massacre, while in Spain, there were deeply shocking reports of corpses of the elderly being found in all but abandoned care homes. Knowing what we knew of this unfolding terrible tragedy, why were our care homes not locked down sooner? Why was PPE not immediately sent in? And why haven't the tests been provided for all those living in our care homes? Andrea Lyon, the manager of Oak Springs, says, I quote her, the government's plans should have been ready to be actioned immediately, not 3 weeks down the line. I had to take care of my residents with less than 50% of my staff because the government didn't have their action plan ready. She says, it makes me very angry. My Lords, that anger will have its day during an inevitable public inquiry. But if any good is going to come out of this rupture in our equilibrium, there'll need to be radical and fundamental change. Everything from our supply chain resilience to national self-sufficiency to inequality and to social solidarity. What the deaths in our care homes have made abundantly clear is that alongside our National Health Service, we need a National Care Service. If a National Care Service emerged from the wreckage of Covid-19, it would represent a gain amongst so much loss, comparable to the gain of a National Health Service in 1945.
Lord Hunt of King's.
My Lords, I'm very glad to speak in this debate and to pay tribute to my noble friend Baroness Wheeler for an excellent introductory speech. And can I say I also very much agree with Baroness Wheeler in terms of praising the amazing work of care workers at the moment. And they have been left almost defenceless by the lack of preparation. And I'm afraid this is yet another indication of how far down the food chain the care sector is in the government's concerns. My Lords, I'm particularly concerned about the financial vulnerability of so many care homes. But Viscount Astor has asked the Minister to ensure the money routed through local government actually gets to those homes. But as Baroness Wheeler has said, even that is not enough to ensure their financial viability for the future. And I hope he will reassure us on that point. My Lords, there is a great risk that with all the focus going on today on the crisis, that the fundamental reforms needed in the care sector is going to be put on the back burner. And yet we know from the House of Lords Select Committee, Economic Select Committee, that we have a huge amount of unmet need, that the demographics mean that that need is going to grow. And my Lords, we have a vicious cycle here. After decades of reviews and failed reforms, the level of unmet need is growing, the pressure on unpaid carers grows stronger, the supply of care providers is diminishing because of their financial vulnerability, and the strain on the care workforce just gets worse and worse. And that's before the new immigration cap comes in towards the end of the year. Now, the government has agreed to extend the visas of doctors and nurses due to expire on the 1st of October, but inexplicably, this does not apply to care workers. My lords, we have been long promised a government response to the long-term care crisis. We were promised this in 2017. It was promised again in 2019 during the general election. I urge the minister to ensure that they do not backtrack on ensuring that we see very soon strong proposals for the kind of care system that we need, so that never again we see this dreadful situation where people in the care sector have been neglected and frankly treated very much as second-class citizens.
Baroness Wheeler.
Thank you. My lords, I too would like to thank the noble lady for securing this vital debate and also pay tribute to those working in the care sector. Many lessons will need to be learned after this pandemic is over. There are things we already know. We knew, for example, that a pandemic was a national threat. Epidemics have always been a global threat, but SARS showed that an epidemic could spread to all continents in the time of a plane journey. We have long known the weaknesses in social care. Much of Beveridge's cradle to the grave support was in place by the mid-20th century: free education, unemployment support, pensions, and from 1948, free healthcare. The one huge area that wasn't covered was social care. There was report after report in the second half of the 20th century, in the beginning of this one, as the noble Lord Hunter's just made plain. Everyone agreed that health and social care needed to be seamless. When my own father was diagnosed with terminal cancer in 2007, he lived for 6 weeks. In the first 2 weeks, he was given amazing help with pain relief. The next 2 weeks was simply a battle between health and social care as to whose responsibility he now was. Only the last 2 weeks of his life were at home, where he wished to be. The divisions between health and social care have been shown up in lethal form in this epidemic. Hence all the problems that others have mentioned: lack of coordination, funding, recognition, equipment, advice, as laid out so powerfully by my noble friend Baroness Tyler and others. There were attempts at cross-party agreement on social care before the 2010 election, and the minister needs to know that his party scuppered that. In the coalition, we commissioned the Dilnot report to seek more stable funding of social care and to protect people against extreme costs, as the NHS does in health. Labour supported this, which was very welcome. But after the 2015 election, it was set aside. Many of the problems that noble lords have raised stem from the inability to integrate health and social care properly and to value both. We must indeed never be in this situation again. And when we emerge, this is an area which must be urgently and effectively addressed. And I hope the noble Lord the Minister will tell us today that he agrees.
Baroness Beecher. Baroness Beecher is not responding. I call on Lord Dubs.
Thank you. Let me congratulate my noble friend Baroness Wheeler for initiating this debate and for her very powerful speech. I should declare an interest in that a member of my family over the years has been in care homes. He now has support in his own home, but I have some experience of how these things work. The first problem, I think, is the poor statistics about this whole sector. We're beginning to get more information together, but it seems to me that unless we have clear statistics so we know what the position is, we cannot easily change policies for the better. And we know that many of the problems with social care are long-standing and exist for years before this present pandemic crisis hit us. But it meant that this sector was ill-prepared for the difficulties we are now facing. One example that's been often quoted is the long journeys that workers in care homes have to take to get tested. I was told of one person who had to travel from Bournemouth to either Gatwick or Chessington to be tested, 100 miles each way, an impossible journey for people who are hard-pressed at their places of work. And we all know social care has for too long been the underdog. Acute services have tended to get the money, not enough. I wouldn't take a penny away from acute services. In fact, I'd rather put more in. But social care has still tended to be the underdog, as characterized by the very, very low levels of pay that are earned by people in the social care sector. We know there are wonderful people working in social care. We know how hard they work, and we know about the wonderful long-term relationships that they have established with the people they care for, making the death of such a person they care for even more painful. And of course, we must ensure that they have security in this country, and the issue of visas has got to be dealt with. My lords, of course, we need more testing. It's already been said, and of course, it should have happened a long time ago. I understand that residents with symptoms and those being transferred to care homes will now be tested. I wonder when that will be completed, when all workers in care homes and indeed in domiciliary care will have had a chance to be tested. Let me just mention in passing that not all people in care are elderly. There are young people who need help as well, and their problems are slightly different from the needs of the elderly, but they're still important. Let me turn to domiciliary services. They tend to be forgotten. The visits by care workers to homes where there is a single person isolated on their own are crucially important, not just for their health and for their care and for their needs, but also to lessen the sense of isolation. And often it is the domiciliary workers who call on people's homes who provide the only link with the outside world. And if, because of the present crisis, that were to stop, that would be a disaster. Of course, as a society and as a country, we depend very much on family members to provide the care. If one of them falls ill, then there's an even more difficult situation for the care workers who have to come in. And that appears to be the difficulty at the moment. I know of one care worker who has a long journey by tube every day to go to his place of work. He's given 2 masks per day, or he was until recently, 2 masks a day, which is hardly enough, given he visited many, many people per day and per week. Looking at it very briefly in the long term, surely the social care sector needs a sustainable funding settlement, one that it can look forward sensibly to the future. We have to reform the social care system, and surely the long-awaited green paper must say something about it, although I suppose that is a long way away. And finally, can I say this? I heard somewhere an idea which interested me. In many sectors of health, there are all colleges. There are all colleges of GPs, there are all colleges of physicians, and so on. Wouldn't it be right if the status of social care, both those working in care homes, but also those in the domiciliary sector, if they had a Royal College of Social Care to speak for them? Wouldn't that be a good idea? Wouldn't that be able to fight their corner better than it's being fought for at the moment?
Baroness Findlay of Llandaff.
My Lords, I thank the Noble Lady Baroness Wheeler for this essential debate. This pandemic has become a palliative care emergency, and I declare my role as Vice President of Hospice UK and Marie Curie. The care sector staff are providing extensive end-of-life care. They are skilled, compassionate and motivated, but low paid and until now have been unnoticed and unappreciated in society. Yet the mark of a civilised society is the way it cares for its vulnerable. The care sector is a bedrock of such a society. Some of the most vulnerable can be difficult to care for. The Mental Capacity Act framework supports delivery of essential care and treatment, but safeguarding is harder, and COVID guidance on the deprivation of liberty safeguards, or DOLS, leaves greater responsibility on care staff while reducing bureaucracy. Chairing the National Mental Capacity Forum, which I declare, I see the care sector adapt with enthusiasm and profound caring to the challenges. Yet the care home staff feel abandoned. Personal protective equipment and testing for all care home staff and residents weekly are critical in controlling cross-infection. So I asked the Minister, when will this happen? Staff from minority populations seem at higher risk of serious or fatal COVID-19. They are not deserting, far from it. They are showing humanity and compassion in care. As a nurse said, I'm like a policeman facing a terrorist attack, ready to face it, but what will happen to our family? That's the only worry I have. So I ask, who is responsible for staff death in service financial support? Dying residents need medication for symptom control. For care homes without easy, rapid access to medicines, why has the repurposing of medicines not yet been approved? I tabled questions on it on the 7th of April. Draft guidance was produced on the 14th and on the 20th issued in Northern Ireland. Why not England and Wales? And I asked the Minister, has every clinical commissioning group been instructed to achieve integration with its social care providers in the long term? Is it time to develop nursing home medicine to support social care delivery as a distinct discipline and fully integrate health and social care? It should have happened a long time ago. It must happen now.
Baroness Wheeler.
My apologies. My Lords, I declare my interest in the Register as Chair of Dignity in Dying. One of the unexpected outcomes of the pandemic has been, albeit very late, a national awakening about the vital role of care workers, their commitment, their determination to continue caring for their most vulnerable of patients, risking their own lives in the terrible absence of PPE. This is surely the moment to re-evaluate the care sector, not just for now, but for the longer term. We know that care home residents who contract COVID-19 are generally not encouraged to go to hospital. Their end-of-life care is left in the hands of the care staff. This may be the wish of the patient, but we don't actually know this is the case. Are the wishes of the patient the determining factor in decisions about hospital admission and other end-of-life decisions? Many noble lords have focused upon the vital funding issues for the social care sector. I want instead to focus on the implications of the vital role in end-of-life care being played by care homes, not only during this crisis, but always. The reality is that care homes are alongside hospitals and hospices in caring for the dying. This is skilled work. Apart from the physical nursing care and symptom relief, are skills in assessing the mental capacity of patients and in undertaking sensitive conversations about the patient's wishes as their condition deteriorates, and the preparation of advanced care plans. All this has come to the fore in the COVID-19 crisis, but of course, these skills are always needed in care homes. We need to revisit the training, skills and pay of care staff. I welcome the advice of the CNO and Chief Nursing Officer on the 7th of April, encouraging vulnerable patients to discuss their treatment preferences and to record those preferences in an advanced care plan. Only then can we be sure that their wishes are respected. This advice should apply much more widely. None of us knows when we will be struck down by a heart attack, a stroke, or a deadly virus. Every one of us needs an advanced care plan. A number of charities, including Prostate Cancer UK and Compassion in Dying, the sister charity to Dignity in Dying, provide excellent materials and guidance on end-of-life planning. But these services need to be supported by the government, not just now, but in the future too. In this context, I strongly support Care England's call for a commissioner for older people. Can the Minister set out the government's response to this proposal? When people think about dying, they desperately want to seize some control over how and when they die. A commissioner could help to achieve this. Sadly, many COVID-19 victims suffer terrible deaths. Their end-of-life wishes were never known.
Lord Way.
My Lords, I want to thank Baroness Wheeler for tabling this very timely debate and declare my interest on the Lord's Register. I too echo the praise others have expressed to the government and our heroic NHS and care workers, especially on the front line. Given the time, I want to focus on just two issues relating to the handling of the crisis. with social care during this pandemic. I'm concerned, my lords, at how centralised an approach Public Health England has taken on a number of fronts, which I fear may have contributed to the challenges and deaths we're seeing in the care sector and in non-hospital contexts, generally, including in the home. It seems to me at times we've let the best be the enemy of the good. Alongside a narrow focus on centralised testing and on healthcare versus what else can be done with the rest of society, including business and citizens, PHE maintains, I fear, such a gold standard that delays and an inability to harness the energies out there can often be the result. It seems to me we need to do more to loosen regulations in this emergency, to allow more localized testing operated by local labs and organizations to be enabled, and then shared open source, as well as a provision of PPE, and even have trials of new drugs made available both in and near residential homes as well as in social care contexts. I'd be keen, therefore, to learn from the Minister whether PHE is being instructed or, if necessary, bypassed to enable more third-party innovation and involvement, and whether a bill or instruments will be passed to relax certain rules so that local actors can be empowered to make decisions as they see fit more. Indeed, lessons need to be learned so we can build a more agile, decentralised model of healthcare for the 21st century delivered closer to homes generally. Finally, my lords, I want to ask what action is being taken and resources being deployed to separate elderly residents of care homes with mild symptoms or who've been tested as asymptomatic from other residents without the risks associated with admitting them to hospitals. Does the Minister agree we may need to introduce a programme akin to the Nightingale one, but more like the famed Little Merchant Navy that complemented the naval efforts to evacuate Dunkirk? That where we can build and create facilities close to care homes for isolating elderly and vulnerable people, and then testing and those testing positive of all ages but with mild symptoms, separating them from mainstream care and the general population who do not need hospital care but who might be at risk of infecting others fatally.
Baroness Sherlock.
My Lords, I'm grateful to my noble friend Baroness Wheeler for securing this debate and for her excellent introduction. I want to raise the financial circumstances of care workers, especially when they get sick. Care workers are on the front line doing important work in highly risky conditions, usually for minimum wage. But what happens if they get sick? Let's look at two circumstances. First, a carer working in a care home for 35 hours a week at minimum wage, taking home about £277 a week. If she develops symptoms and has to isolate, the good news is she qualifies for statutory sick pay. The bad news is SSP is just £95 a week. So overnight, her net income falls by 2/3. Can the Minister tell the House how she's meant to manage? Can she apply for universal credit to top up her SSP? Because that's not made clear on any of the government's web pages. The second example is someone caring for a number of people in their own homes and travelling between them. She works for two different employers, but doesn't earn enough in either job to qualify for SSP. If she needs to isolate, she would have to claim universal credit. But how long would that take? The last figures published for statistics on universal credit showed an average 40,000 people a week claiming the benefit. But in the last month, 1.4 million have applied. So can the Minister tell the House what the average wait is for someone who's applied for universal credit in the last month? Secondly, even if our care workers' claim is processed quickly, there's a built-in wait of 5 weeks to get money on universal credit. She can ask for an advance, but that's a loan deducted from future universal credit payments. She's only just managing as it is and is scared of getting into debt. My Lords, Ministers have made some welcome changes to universal credit, but these case studies show that their carers need more. We need action on the 2-child limit, the savings threshold, and the failure to uplift legacy benefits. But most urgently, I want to plead again with Ministers to abolish the 5-week wait in universal credit. And if they can't or won't do that, will they give everyone an advance automatically when they apply, but as a grant and not a loan? My Lords, these may not sound like health issues, but their effects really are. Because if carers can't pay their rent and feed their families, they may feel they have no choice but to carry on working when they should be isolating. That's bad for carers. But also, since their work takes them from one person to another, they must be at serious risk of spreading the virus to some of the most vulnerable people in our country. I urge Ministers to act now.
Lord Campbell of Pitton Weem.
Well, Lords, I too congratulate the noble Baroness Wheeler on obtaining this debate and indeed on introducing it in such a comprehensive fashion. Seems to me, my lords, that the government continues to enjoy general support from the public. But there are three areas in particular where it seems to me confidence is not as strong as it might be. Personal protection equipment, for example, and its availability, the availability of testing. But as this debate this afternoon has eloquently demonstrated, most particularly perhaps the care for the elderly. It seems to me in these areas the government is losing public confidence, and that applies as much to its non-supporters as it does to its own supporters. And thinking of how that has come about, it seems to me that it's because of the fact that undertakings have frequently been given, but have not proved capable of being fulfilled. Now, these issues and other issues discussed by your lordships already seem to me all to be ripe subjects for the inquiry which is to follow, already referred to by the noble Lord Orton. But I want to make this point. We should be clear beyond any doubt whatsoever that we're not looking for a departmental inquiry here. We're not looking even for a royal commission. The only possible inquiry should be an inquiry under the Inquiries Act of 2005, that it should be judge-led, supported by such assessors as he or she may think appropriate. An inquiry which will have the power to compel the production of documents, to compel the attendance of witnesses, even perhaps of the Prime Minister himself. And it must finally be an inquiry which has an agreed timetable to which is followed. And I say that for this reason. This is no time for a Savile or a Chilcot.
Baroness Jones of Molescombe.
Thank you. I too would like to congratulate Baroness Wheeler. I think this is a very timely debate, and it's wonderful to hear what other noble lords have said. I have three questions for the government. They're very simple, and I'd be happy to have written answers if necessary. Like many other noble lords in this debate, I'm actually shocked that the government was so late in taking action to shield those in care homes, in the same way that they were actually very late in banning mass gatherings. And ministers focused on hospital deaths, because that's what their press conference graphs focused on. And the result is that at least 1,000 people died in care homes prior to the Easter weekend. It was a failure to provide adequate PPE to care homes, and it has been, I think, an example of how a government should really not behave. I want to ask about the government guidance which provides for carers to protect themselves in the event that those they are caring for have symptoms. It provides protection for the person that are classed as vulnerable due to cancer or respiratory conditions, but not if they're just old or infirm. And so it doesn't provide for the carers to regularly wear PPE when dealing with the elderly in care homes or in their own homes. So this makes the shield less than watertight. And it's amazing that some care home staff are sleeping with in the care homes and effectively self-isolating themselves to look after the people they're caring for. But obviously not all staff can do that. Often a person being looked after in their own home will only have contact with the outside world via their carer, and that makes the carer the sole source of any infection that occurs. And the burden of responsibility on carers is huge. So the government needs to change its guidance to reflect that, along with the supply of PPE. So my first question is, will ministers tighten up the guidance that carers operate under? And my second question is about the sending out of mass do not resuscitate letters to elderly patients. It's one of the more dubious decisions that was made. I know that many GPs have wanted to have individual chats with patients and to shape their care accordingly, but ministers need to clearly state that if the elderly need hospital care and want hospital care, then it will always be available. When entire care homes of patients are being expected to sign do not resuscitate notices, it can be taken as a clear message that they are expected to die in the home and not receive treatment that perhaps younger people might. So I would ask that whether or not that practice has actually stopped. I would also like to ask if the Minister can reassure the House that there is now real-time information about what's going on in care homes, and actually to know exactly how many people are dying instead of guesses that are so late. I understand the difficulties, but really it's only when we know the size of the problem that we know how to deal with it.
Baroness Keithley. I call Baroness Keithley. We'll then move on to Baroness Watson.
I'm here, Lady Finlay.
Thank you, Baroness Keithley.
My lords, as my noble friend Lady Wheeler indicated in her powerful opening speech, there are many shocking statistics about the care sector when it comes to thinking about delays. Like others, I was duly shocked, but in all conscience, I cannot say I was surprised. When has the care sector ever been at the forefront of the news? When has it ever been top of anyone's agenda? How many years did it take for the Department of Health to change its name to the Department of Health and Social Care? The notion that the social care sector is somehow second class probably goes back as far as 1948 and the founding of the NHS. Back then, men died at 66 and women at 69, so why bother setting up a fail-safe care system when it would not be needed? We reckoned without the wonderful success of the NHS in extending our lives so that we see not only our monarch, but many of our most successful fundraisers playing important roles well into their 90s. The government's recent bailout plan is extremely welcome and much needed as local authorities are pushed into insolvency by the extra demands of this crisis. At best, though, the £1 billion buys us a month or two, as one council leader said. And it is now more than 4 years since the CQC told us the social care sector was at a tipping point. If that was the case in 2016, how much more is it the case now? We must always remember too, when we celebrate caring, the contribution of the unpaid army of at least 6.5 million unpaid family carers, rising, we think, to more than 8 million according to later statistics. These families and friends are holding the social care system together by providing support for the most vulnerable in society, saving billions of pounds for all of us, the cost of another complete national health service. Many carers were at breaking point before, and the current crisis has further exacerbated their situation, and many now say they are sick with worry. We are asking even more of these carers than ever before, and they too urgently need to be supported and recognised. They need to know how to keep themselves and the person they care for safe. Many are worried that the care workers who previously supported them are bringing the virus in, so they are doing more themselves. Many services which previously supported carers are now closed. Day centres, for example. Even before the virus, 40% of carers providing substantial care had not had a day's break in more than a year. So there was already considerable unmet need. We should be concerned with the local authority and charity sectors being under such pressure. As we have heard, there is a worry that these services may never be resumed. Some carers are even finding it difficult to get food and supplies. Not all supermarkets class them as vulnerable, and not all carers are as tech savvy as we are all learning how to be. When someone needs care 24/7, it is hard to find the time to learn a new skill, even if you can afford to buy a computer. Carers UK has conducted research with carers looking at their experience of Covid-19. It had a large response in a very short period. If I send the Minister a copy as soon as it is published, will he undertake to provide me with the government's response to the issues the research raises? It is clear that coming out of the pandemic, we will need to have short-term funding for care to stabilise the system. But beyond that, my lords, we must finally commit to a bold solution for the future funding of social care. Many of us have been calling for such a commitment for many, many years. Would we dare hope that a positive outcome to what we are now experiencing is that we will finally get such a commitment?
Baroness Watkins of Tavistock.
My Lords, I welcome this debate and thank Baroness Wheeler for securing it. It's clear from NHS providers' briefing of yesterday that the social care sectors, including hospices, care homes and domiciliary providers, are beginning to consider closing to new admissions or taking on new people for support in the community due to worries about the need for PPE to protect residents and staff from cross-infection of Covid-19. Nearly a sixth of care homes, as of the 13th of April, reported expected outbreaks of Covid-19. This means that many care homes do not have enough staff, and other noble lords have spoken eloquently on this issue. But it does mean that it will be very difficult to discharge people from hospital care if care homes are not in a situation that they can either give them short-term care or if domiciliary care can't be organised. The shortage of PPE is more extensive, serious and difficult to overcome in some places more than others. It appears that care homes that are members of large chains are beginning to find solutions to short-term procurement. However, even these larger companies are extremely concerned about the increased costs of PPE. It is therefore almost impossible for small domiciliary care providers supporting vulnerable children, people with mental health problems, and older people in their own homes to purchase necessary PPE in a timely and cost-effective manner. I ask the Noble Lord the Minister to explain the government's approach to these providers and how they intend to make access to PPE available either through national or local procurement and delivery in a cost-effective manner. If social care is to be successful and sustainable in terms of taking on new clients, as well as providing high quality care to those who receive it, we must reduce the feelings of fear in terms of employment and right to remain for carers from overseas. The government's new post-Brexit immigration scheme is based on treating health and social care workers differently. The Home Office plan will enable doctors and nurses to apply for fast-track NHS visas, but care workers will have to apply to come under the points-based system. Nearly a fifth of all care workers in this country come from overseas, many of whom may choose to return home in the next year. Yet the Home Secretary does not at the moment see a need to apply a fast-track system for care workers. Please could the Minister comment on this approach and inform the House if it is to be reviewed. I also have to ask, as other noble lords have done, will the government consider scrapping the £400 a year NHS surcharge for both health and social care workers? Because if we are to recruit and retain our workers, I believe this is vital at this point in our history.
Could I ask that Baroness Warwick of Undercliff could stop sharing her screen by clicking the box with an arrow in the command bar, please? And could I call on Lord Turnberg to speak next?
My Lords, I want to raise three questions with the Noble Lord the Minister. None of them are entirely novel since they concern testing, how we treat care home staff, and the logistics and government control. Now, those who are gifted with hindsight can see quite clearly now where the government has gone wrong. But you don't need to have much of a retrospectoscope to know that we have been extraordinarily slow in recognising that care homes were ticking time bombs full of closely gathered, extremely vulnerable elderly people being looked after by carers who had long been the most underappreciated and under-supported of health workers. You might have thought that this combination was a devastating disaster waiting to happen. But rather than getting into the blame, we must look at what's needed now. And firstly, in order to get a much firmer grip, the government should appoint a minister, or better still, a well-respected authority to oversee the logistics of providing protection of care home residents and staff. and whoever is appointed should have that as his or her sole responsibility. It's no good distributing responsibilities between different parts of the government. It should be one person with no other responsibilities and focused entirely on coordinating the response and reporting regularly to ministers. Will the noble Lord, the Minister, say whether this is already happening? And if not, can it be undertaken sometime soon? Secondly, it's now clear that we seem to have more capacity to test people for the virus than we have people able to access the tests. The reasons why care workers and residents can't do so have been well rehearsed in the debate so far. The answer is obvious. We must take the test to those who need it. I hear that the government intends to set up a system of mobile testing units that can go around care homes and elsewhere, and that the army will be involved. That's a step in the right direction. But can the minister say how quickly that can be scaled up? And why do we need the army when taking samples from staff and residents only requires about an hour or so of training, and we have a huge number of volunteers ready to help? And thirdly, finally, my lords, we have been debating in this chamber forever, it seems, about the parlous position of care home staff, how underappreciated, poorly paid, and unregulated they are. And several of my noble friends, Lord Hayne, Lord Hunt, Lord Baroness Pitt-Keithley, Baroness Wheeler, have talked about the terrible position they're in. The coronavirus is now transforming our neglect of them into some form of hero worship. We must take advantage of this newfound recognition to change the way we show our appreciation as we come out of these horrible times. And whatever we do, we have to recognize that a majority of our care homes are in the private sector, where they've long struggled to keep their heads above water, and we must include them in the rescue. Local authorities need support now. But may I ask the noble Lord, when the government eventually, at long last, comes to its review of social care, it will put the conditions of care workers right at its heart.
Thank you. I apologise, Baroness Warwick of Undercliff. If you're able to close the box that has a small cross on it in the middle of your bar, that would help, because the screen is distracting for others. Could I call on Baroness Wilcox of Newport, please?
Thank you. My Lords, I thank my noble friend, the Baroness Wheeler, for bringing this important debate today, and indeed for her excellent speech. I'm in close contact with the Welsh Government and local council leaders in Wales. Therefore, my contribution to this debate will focus on the provision in Wales and demonstrate how social care services are being sustained at this critical time. A group of ministers have twice weekly calls with all council leaders. In addition to this, there's constant contact between central and local government officials. As you know, my lords, the Coronavirus Act 2020 allows local authorities flexibility in the provision of care, but children were not included in this for Wales, unlike in England, so the legal protection for children's care and support is being maintained in Wales. £40 million has been provided in emergency funding for social care for an 8-week period via local authorities, but much more funding will be needed from the Westminster Government. This funding is meeting the increased costs of PPE, food, staffing costs and ICT that's being incurred by adult social services. This comes from a £1.1 billion funding fighting fund created by the Welsh Government to support public services to respond to the pandemic. But 10 years of underfunding has seriously impeded the Welsh Government's ability to respond financially. Now, the government's budget is billions below what it would have expected to receive based on its first decade of funding from a Labour government. It has, however, as my noble friend Lord Hayne noted, consistently spent more, 48% more on social services in Wales than in England, and how much better the UK care sector would be across if the focus had been taken by the UK government. The Welsh Government has written out to all registered providers of care home services, highlighting the need for care homes to sign up to the new care and support capacity tool, and for care homes to raise concerns with their local authority and with Care Inspectorate Wales without delay if they consider there to be imminent risks to the continuity of care. 40% of all PPE now being distributed by Welsh Government is going to social care, and the testing of social care staff and residents of care homes who are symptomatic started in Wales before it did in England. It's a shame Dominic Raab didn't mention that fact yesterday in the House of Commons when attacking the work of the Welsh Government Minister in charge of health. Wales is the only UK country providing free childcare for all preschool children aged from 0 to 5 and for vulnerable children, those with social workers or a statement of special educational need. Testing is an evolving area of work at a time when Public Health Wales continues to increase capacity for testing through the establishment of drive-through testing facilities. My Lords, I hope this very brief but detailed account of work being undertaken in Wales brings some reassurance to members that the Welsh Government is in close liaison with local authorities. They are carrying out their duties at this critical time, and I urge the UK Government to fully fund the work of Welsh Government in dealing with this pandemic. Thank you.
Lord Shipley.
My Lords, I thank Baroness Wheeler for enabling us to hold this debate. And I want to concentrate on emergency planning and procurement, the overall impact of government policies on the social care sector, which Age UK said last week was an unfolding disaster, and the lack of integration of health and social care. I should declare that I'm a Vice President of the Local Government Association, but I do want to say that local government has mostly done a very good job in providing community leadership and in supporting vulnerable people in this pandemic. But it has puzzled me as to why our emergency and resilience planning generally has not worked well, and it seems to result from the government's failure to plan effectively for a pandemic since 2016, despite advice which had identified PPE shortages as a major risk. Secondly, the lack of action in February to treat the pandemic as seriously as other countries were. And thirdly, the government's policy of running a centralised procurement and distribution system, which has ended up with shortages of essential equipment. And my Lords, I draw two lessons from this. A country of our size cannot be run out of Whitehall or its centralised agencies. We should learn from Germany, where more responsibility lies at a regional and local level for procurement and for testing, tracing and isolating. And we need to be far more resilient as a country, manufacturing more ourselves. The international shortage of PPE has impacted directly on care homes where deaths have soared. And the government seems to have had no plan for the care sector. It should not have been surprised that PPE would be needed by so many organisations outside the NHS, and nor should it have been surprised by the need to test. Yet, by Easter Monday, only 505 social care workers had been tested, compared with 48,000 tests for NHS staff. And as we've heard, location of testing centres has meant that many on low incomes have had to travel unacceptably long distances for testing. Despite its title, the Department of Health and Social Care, the care sector seems a poor relation. My Lords, we need a fully integrated National Health and Care Service. We have voluntary integration in only a third of England. There are 430,000 residents in nursing and residential homes, with care fragmented between the public, private and not-for-profit sectors. The financial situation for many of those homes is dire, as we've heard. Reform to the financial structure of social care is urgently needed, and it really is time for the government to provide the necessary leadership to start to solve this huge problem. My Lords, I am grateful for the opportunity to take part in this debate.
Baroness Uden.
My Lords, I declare my interest as a former statutory social worker and a mother to a person living with autism. I wish to express my heartfelt condolences to all those who have lost their loved ones at these horrific and tragic past weeks. My Lords, these are sad times, and I thank my noble friend, noble Lady Wheeler, for leading this discussion, and agree wholeheartedly with her invaluable and detailed insight, and endorse completely the comments and concerns expressed by my noble friend, Baroness Gray Thompson, Keithley, Baroness Keithley, and noble lady Baroness Jolly. Our nation is indebted to all staff at frontline of NHS and our social care sector. Even at these unprecedented times, we have witnessed exemplary appreciation and respect for their unflinching bravery. In fact, there are infinite numbers of men and women creatively assisting their local services, including care homes, some privately purchasing protective equipment running out rapidly. This is reinforced by Excel Care, national provider of 33 homes, including in my constituency. Indeed, I feel proud of the work being done by many local and national charity organizations based in my area of Tower Hamlets. And despite the lockdown, neighbors are supporting one another and organizing food packages for frontline staff. By all accounts, this is being replicated in every part of our communities. My lords, I commend to the House work of two organizations, one Bangladeshi catering industry, which have turned restaurants, kitchens to supplying free food for thousands of vulnerable families at breaking point, as well as NHS and care staff. The other is a satellite TV channel, Channel S, team which is providing outstanding public services in mobilizing communities, helping people suffering extreme hardship. Similarly, for those who are finding it difficult to access financial services, measures in place. The channel has ensured the government messages and instructions reaches their vast pool of bilingual audiences, in addition to helping charities raise hundreds and thousands of pounds for invaluable, vulnerable families at home and abroad. My lord, each day is a forbidding challenge for many who are suffering poverty, domestic abuse, and multiple frailties. Nevertheless, it has been a privilege to witness human spirit thriving in communities coming together as the month of Ramadan begins tomorrow. These collective efforts will intensify unabated to help all sections of the community, regardless of age, ethnicity, and faith. May I conclude by asking the government if they have undertaken an impact assessment of the current pandemic on people at special schools, daycare center, and other residential care institutions which provide services to disabled people, children, and adults with learning disability and autism in terms of availability of PPE, staff, and adequate resources. Second, what protocol exists for carers accompanying disabled children and adults to hospitals should they contract COVID-19? And the final one is the Children Commissioner is concerned about drop in number of children on safeguarding and child protection register attending schools. What is being done to ensure local authority have adequate social work staff and resources to maintain sufficient monitoring of their safety? I thank the Noble Lords for their cooperation and attendance.
Baroness Bull.
My lords, I join others in thanking the Noble Lady Baroness Wheeler for raising this important debate, and will focus my comments on the impact on the UK's 1.5 million people who are living with learning disabilities. Their challenges have been exacerbated by this pandemic. They're already 7 times more likely to be socially isolated and to suffer mental health problems, and so they are at particular risk from the effects of quarantine. They're challenged to understand social distancing, and they're at high risk of respiratory problems, which makes them more vulnerable to the virus. While the Action Plan for Adult Social Care acknowledges the COVID-related challenges of this community, disability advocates have raised a number of concerns about the plan and about the sector's specific challenges. Workforce support is a key pillar of the plan, but it's silent on pay increases, which is a significant factor in retention and recruitment. And as the workforce includes 115,000 people from the EU, staff shortages are a long-term concern. Concerns have also been expressed that the 1.6 billion emergency funding for local authorities to support social care providers is insufficient and distribution uneven across different areas. The Noble Lady Baroness Jolly has already articulated concerns about guidance on the assessment of people with learning disabilities who contract COVID-19, with GPs wrongly conflating support needs with frailty and telling people they will not be prioritised for treatment. Finally, there are concerns about flexibilities to social protection introduced by the Coronavirus Act. Can the Noble Lady, the Minister, provide reassurance that people with learning, the Noble Lord, the Minister, provide reassurance that people with learning disabilities will not fall through gaps and end up locked away in inpatient units. There are already 2,000 people in these units, often far away from their families and held in inappropriate environments, sometimes confined to a single room while awaiting completion of care and treatment reviews. I know personally one family in the midst of such a process, a long-awaited solution tantalizingly in sight before coronavirus put everything on the back burner. Can the government give this family and others like them reassurance that their needs will not go to the back of a long queue or be forgotten altogether once this immediate crisis is under control? My Lords, the desperate need for long-term reform in social care has been highlighted yet again by the situation we now face. In 1942, when the world was at war, the British government produced the Beveridge Report and with it, the basis for the welfare state. This crisis must inspire the same sort of visionary thinking. It's not just a question of how we react to this pandemic, it's about the legacy that this generation will leave behind.
Lord Farmer.
My Lords, I too wish to congratulate Baroness Wheeler on initiating this important and very well-timed debate. I wish to speak today about children's social care and how supporting those on the edge of it can prevent this crisis being the tipping point when they become looked after by the state. First, we should acknowledge the families who are actually flourishing now they are no longer in the time famine of normal life, even though money and space are tight. Many children are enjoying being with their fathers, for example. Turning to those in social care, the government is consulting on reforms to the use of unregulated care homes, which include banning this provision for under 16s and introducing national quality standards. In these very strange times, young people currently in such accommodation are out of sight for social workers and others who have high caseloads. I have heard these professionals are seeing only the highest need families face to face. Some have adapted well and are catching up with young people directly, for example, through WhatsApp, but such flexibility might be patchy. Can the Minister inform me if a national assessment has been made of the welfare of those in unregulated accommodation during this crisis? More broadly, the government has committed to reviewing the care system. For it to be sustainable going forwards, this review requires what I call the prevention pipeline. It should establish how we can best prevent A, children coming into care in the first place, and B, the care system from being a runway into educational underachievement, unemployment, criminality in prison, early parenthood, addiction, and poor physical and mental health. Early family support is essential to prevent children tipping across care thresholds. Many local authorities have set up family hubs where families with children of any age can access help. I have set up the Family Hubs Network, which has held several virtual roundtables with providers who report that hubs have come into their own in this pandemic. They're offering food, maternity appointments, a rich program of online family support and more. I understand DFE are leading on family hubs, but can the Minister inform me if and how they are supporting their spread? Thank you.
Baroness Wheeler. Baroness Wheeler. We'll then move on to Lord Adlington.
My Lords, I'd first like to thank Baroness Wheeler for bringing in this debate and say that I have agreed with many of the things which have been said beforehand. Before moving on to the main point I wanted to make, which is in the title of the debate, which is about looking at the long-term impact for groups, particularly those who are the adults and those who are in care and receiving supporting care. Now, we've already heard from many people here about the impact that the lack of PPE and testing has had on the workforce. If this group, which is under tremendous pressure, then has to deal with groups who are actually going to react badly to the situation they're in, and I'm particularly thinking about those with autism, a group which has trouble understanding the world they're in and the relationship to what's going on and find much of adult life overwhelming. if they are having to deal with a group who are actually going to have problems and mental health problems, in the future, their job is going to get so much more difficult. Are we going to make sure that the government that they actually go to these groups and make sure that they get support as soon as possible? How long the lockdown lasts will actually greatly affect when you can get in and the level of problem you have. But the government must have some idea of what strategy they will have when the immediate crisis ends. We must be able to go in and say there will be support for this, for your mental health and social anxiety problems. I started with autism because I know slightly more about it, although acutely aware that others know more. But all the groups, indeed the ones Baroness Bull mentioned earlier, will have similar types of problem. Can we please get an idea of the strategy for dealing with the long-term consequences of this huge social disruption for those who are being looked after? Because those who are going to take on the caring are going to have to deal with the problems. It will be yet another load for them to carry. A group which have been undervalued for a long time. This House has been particularly good at actually making sure that people recognise that they actually do have value and have worth. But government is now going to have to make sure, unless this immediate problem becomes a long-term one, that we actually have greater help for them. In other words, I will leave it there, but please can we hear from the government about some long-term strategy despite the overwhelming problems of today?
Lord Little.
My Lords, I'd like to declare an interest as a member of Cumbria County Council. I'd like to take as my text, as it were, for the excellent opening speech of my noble friend Baroness Wheeler, where she emphasised, I think the quote was, that the COVID crisis has brought the social care crisis to the fore. If I can use a phrase we're unfortunately hearing too much of at the moment, I think the social care sector has suffered from a lot of pre-existing conditions which have sadly weakened it. It's not been ring-fenced from austerity to the extent that the National Health Service was in the austerity of the last decade. Recently, we've had the sticking plaster of the social care precept on the council tax, but that's very inadequate. We're facing a rapidly aging demographic, but it's the structural problems of the sector on which I'd like to focus. The fact that many of the providers of social care are on the edge of bankruptcy, the fact that it's a sector which has seen widespread financialization as big companies and private equity groups have moved in, where they have been loaded up with debt and the margin of profitability is very low, where property has been sold off at high prices because of promises of high rentals, which are probably now unsustainable. It is a sector in deep crisis, particularly where there is private ownership. And we have to tackle this problem. Now, part of the problem is the lack of a long-term stable funding of social care. I think it was a mistake not to go ahead with the Dilnot recommendations. And Boris Johnson promised us in the general election action in months on a stable funding for social care. This crisis should be a reason for bringing that forward, not for postponing it. But if we do get more stable funding, we've got to ensure that that funding just doesn't go into rescuing bankrupt companies in order to make them viable for their shareholders. We want to see a new deal for people working in social care. And I think that there has to be statutory arrangements made in this sector to improve pay and conditions. And I'd also like to see, and my experience as a county councillor, honestly, has changed my mind about this. I actually think that we need an expansion of local authority care. In my own county council division in Wigton, we have an excellent local authority care home. Unlike most authorities, Cumbria didn't privatise all its care homes. Indeed, we're building new ones. And this, my care home in Wigton has been rated excellent 2 years running by the Care Quality Commission. Now, I think we need a bigger role for the public sector in the provision of care. And I think that that would enable decency for workers who are doing such a valiant job in present circumstances. And it's got to be backed up by action now on a long-term funding solution for the sector. Thank you.
Lord Tyree. Lord Tyree. We'll then move to Baroness
Thank you very much. I am here. Can you hear me?
Lord Tyree.
Yes, thank you. My lords, I agree with a very great deal of what's been said. There have been some extremely powerful points made, and I will confine myself just to making one further point about making sure that we maximise the effectiveness of public expenditure in this environment. The underlying objective of policy must be to minimise the loss of life from the epidemic. And the challenge is to find ways of using all the resources available for that job. Some core facts help us think about this. We know that 80% of deaths are likely to be among the over 70, and we know that most of the remainder will be among those with underlying health conditions. It must follow from that that a very robust lockdown, with whatever financial support is necessary, in my view, substantially more than currently, to the elderly and other vulnerable groups is needed. And it will need that funding to be maintained indefinitely, unless a vaccine or treatment is found, or unless it turns out, as now seems less likely, that general immunity can develop in the population at any pace. That's the backdrop to this debate. A very high proportion of the most vulnerable people are in care homes, so they need particularly rigorous protection. They need a much more intensive infection control regime than is currently in place, and the public expenditure simply has to be found to pay for it. Of course, the merits of any increase in spending among the elderly and the vulnerable will have to be assessed against the costs of the current indefinite lockdown. But some basic numbers help flag up how clear it is that the money should be spent. The overall cost of the exchequer of coronavirus is forecast to be £218 billion, or 11% of GDP. Total local authority spending on adult social care last year, the year before last, was 21 billion, or 1% of GDP. I think that your lordships can draw conclusions from those figures. Spending on infection control in care homes is affordable when seen against the backdrop of those numbers, and it will pay off and in spades. Of course, analysis of that type can and should form part of an overall assessment of the health effects of the lockdown, both on morbidity and particularly mortality. And I argue for such an assessment and for greater concentration of support in care homes a month ago in the chamber, in the last debate that took place. In my view, it is now absolutely essential. Of course, what I'm describing is very difficult work, but it seems to be scarcely less difficult and uncertain than the work that's already being undertaken on the epidemiology more widely. So I do urge the government not only to undertake that full healthcare analysis, of which the care for the elderly will be a crucial part, including funding on care homes, but to publish it and to tell I very much hope that the Minister today will tell us that it's already underway.
Good afternoon, my lords. I'm now in the chair. I've taken over from Lady Finlay, and I now call Baroness Bowles of Berkhamsted.
My lords, can you hear me? My lords, adult social care in England is inadequately funded. That is the opening line of a strong report from the House of Lords Economic Committee, of which I am a member. And right now, that strained system is dealing with a virus that strikes at vulnerability, the very heart of care services. The government response seems to have inadequate intelligence about how care work operates. How else could the care homes not at risk advice have come about, or low-paid care workers be expected to travel over 200 miles for a test? The virus shows how much we rely on workers in essential services. Care workers rank highly among those, both in terms of society's needs and the risk the workers face. The NHS has high recognition, equipment, donations, and worker visa extensions. The care sector deserves the same. It's time to level up. Just like the NHS, care needs could affect anyone. Half the adult care budget goes on working age adults and is rising as a percentage. Many care provider businesses are now financially at risk, including some employee-owned ones and mutuals. I'm told some local authorities rapidly made 3-month forward bookings and advance payments, taking the financial risks if those places aren't used, in order to help providers keep afloat for the future. Local authorities have suffered lacking and late information in a situation that has moved faster on the ground than government decisions. New funding is welcome, but lags the progress of the virus, both in terms of rising operational and care costs and loss of income from rates, rent and car parks. The knock-on effect of the virus will take a higher toll on the vulnerable, including the working vulnerable, which translates long-term to more care in need. The rulebook on government expenditure has been torn up to support many people and businesses during lockdown. An equally open mind and a long-term approach is needed post-coronavirus. Investment for growth must trump austerity, and social care underfunding must still be addressed. One good faith way the government could start right now would be to put care providers on the same VAT footing as the NHS. Be innovative. It can be done if the will is there.
Lord Bilimoria.
My lords, just today, Dr. Hans Kuhn, the WHO Regional Director for Europe, said, according to estimates from countries in the European Union, up to half of those who've died from COVID-19 were resident in long-term care facilities. This is an unimaginable human tragedy. And the Noble Lady Baroness Wheeler, in her excellent opening speech, said the social care sector is overwhelmed, undervalued and underpaid. And Noble Lord Alton said, we've just heard today that 400 people are now sadly dying of COVID-19 coronavirus in care homes. It appears to be sweeping through the council and privately run care homes, with some estimating that up to 2/3 of their residents are infected. My lords, I'm an association member of BUPA, which has several care homes, and Paula Franklin, the chief medical officer of BUPA, said that it's only last week that the effect of COVID-19 on those who live and work in Britain's care sector has been brought to the headlines. Until then, we didn't even know if they were being counted in the sad daily death rates that are being told to us every day. Now they are. And in many ways, this attention to the care home is welcome and long overdue. Social care is something of a Cinderella sector, she says, within the public health system, and yet the NHS could not function without it, much as we are thankful and grateful and admire the NHS. And COVID-19 has now intensified this right from the start. Although there was a lot that wasn't yet known about the virus, it was very clear from the outset that as society's most elderly, frail and fragile that were the greatest risk from the virus. So while the spotlight has been on the ICU units, those working in social care are now also in the spotlight. They are the second front line in our battle of COVID-19. There are 1 million people in care at homes and in their own homes and in the community, and 1.5 million, 1.6 million people looking after them. Could the Noble Lord the Minister confirm how many people from the ethnic minorities work in the care sector? How many from the European Union? And will we be able to recruit sufficiently after the government brings in its new immigration policies? And when it comes to PPE, many Noble Lords have brought this. It is shambolic that the care sector has not had the allocation of PPE. Will that now be available? And will the Minister confirm the funding, the extra funding will also be made available? And when it comes to testing, the social care sector has been at the back of the queue. Now can the Noble Lord the Minister confirm that all patients in care homes will be tested and all workers in care homes will be tested? And this is a sector where a lot of the people who actually work in it are elderly themselves. They need to be protected and shielded as much as the residents, and yet so many of them are actually now staying in, living in the care homes because they don't want to bring the virus into the care homes. And yet you hear stories of care home patients who go to the hospitals are sent back to the hospitals without being tested. Could the Noble Lord the Minister confirm that testing will be on a regular basis to all people in the care sector, everyone who works in it, the 1.5 million and the 2.5 million people, the patients and the people who work in the care sector, to be tested regularly? So, my Lords, I conclude that the 1.6 million people who work in the care sector deserve the same recognition and the thanks as the 1.5 million people who work in the NHS. And tonight, when we stand on our doorsteps and applaud the NHS, we will also be applauding our care home heroes.
Baroness Altman.
I too congratulate Baroness Wheeler on this debate and her powerful introduction. I will focus on elderly social care and draw attention to my register of interests. And of course, I recognise the unprecedented challenges faced by the DHSC and know it's easy to criticise. So I'd like to congratulate my noble friend, the Minister, for initial action taken to distribute PPE free of charge for use by private social care providers. But we cannot deny that the government's initial approach prioritised the NHS over social care, following the traditional attitude that treats social care as a second-class Cinderella health service, out of sight, out of mind. But, my lords, we also need a wholesale shift in the approach to elderly people. Lumping everyone above a specific age into one group, implying all older people are infirm, is dangerously misguided. So can I ask my noble friend to confirm government policy will not discriminate purely on age grounds when it comes to exiting the lockdown? The physical and mental health impacts of isolation and inactivity on old people are at least as damaging as for other age groups. My lords, we knew from the start, as others have said, that older people who are infirm, were most at risk. We knew where the most vulnerable were, in care homes or receiving home care. Yet there were no special measures for protection of staff or residents, for priority testing, PPE, and treatment of elderly deaths outside hospitals are only being revealed belatedly. But regardless of short-term failings, we do have opportunities to improve things for the future. So can I ask my noble friend to reassure us that the government is now devising urgent plans for radical care reform? In particular, may I ask what his department is doing on the following 5 points? And if time does not permit today, perhaps he could write to me. 1, integration between and provision of and staffing for national health and local care provision, ensuring parity of esteem between NHS and social care. 2, taxpayer funding for basic personal care and incentives for individuals to save to provide a higher standard or earlier access to care than can be offered by the state, as we do for pensions. 3, immigration rules which prioritise workers desperately needed by care providers. 4, attention to ability of care providers so the future of vulnerable elderly citizens is not at risk from the collapse or bankruptcy of highly indebted providers. And 5, focus on prevention of care needs, funding incentive measures to help people stay safe at home and avoid needing social care in later life.
Baroness Massey of Darwin.
My Lords, my noble friend Baroness Wheeler has done us a great service in calling for and introducing this debate, and I thank her. I wish today to talk about vulnerable children, young people, during and after the COVID crisis. There is understandably huge concern about the care of adults, particularly the elderly, but leaving children at risk in relation to education and social care is dangerous and could have long-term implications. The government has issued guidance regarding measures to safeguard children, but many concerned professionals in the local authorities argue that the government guidance with regard to safeguarding of children is not only inadequate but illegal. Some children are vulnerable due to disability, having mental health problems, being young carers, living in poverty, not in education or training, suffering discrimination due to race, culture, sexual orientation, or being in the youth justice system. Many unresolved problems existed, of course, before the virus for these vulnerable groups of children, and professionals dealing with such children were struggling mightily to do their best. The onset of this virus problem could include and expand into a crisis for children. For example, the potential closure of nursery schools, children not receiving adequate education. UNICEF UK has recently carried out a rapid assessment of the impact of coronavirus on children, which is extremely worrying. Many children rely on schools, health and social systems to survive and thrive. These systems are under threat, and a crisis may be looming in relation to welfare and development of children's potential. Child health services, including mental health, are stretched. There will be food insecurity due to job losses and to closures of food banks. There's already stress in families resulting in more domestic violence, doubled, and child abuse. My question to the Minister are how services for children are being currently monitored. Who is the government consulting? Children's welfare is not the province of only one department. Is the government working in a cross-cutting way? My Lord, children have rights as set out in the UN Convention on the Rights of the Child, and we have a duty to ensure that child welfare is paramount. If things fall apart for children during this challenging crisis, the consequences, particularly for the most vulnerable, could be devastating for individuals, for families and for society. The government has unenviable challenges, but I hope the Minister will give us reassurance that support for children and their families will be a priority.
Baroness Hollins.
My Lords, the COVID-19 pandemic will be disproportionately felt by society's most vulnerable people, including people living with learning disabilities. Care Act easements under the Coronavirus Act, enacted by 8 local authorities already, raise the bar for social care to the threshold of human rights violations. Despite government reassurances, people with learning disabilities are at real risk of seeing their care and support reduced or removed, as the Care Act easement set a new high threshold for the provision of care. For those with learning disabilities, COVID-19 has truly pulled the rug from beneath their feet. Visits are discouraged, employment and volunteering roles disrupted, day centres closed. These are not luxuries. They are essential components of keeping well in the community. For many of those with learning disabilities, this loss of routine structure and meaningful human contact could be disastrous. For some, increased anxiety is leading to behavioural challenges that precipitate urgent hospital admissions under the Mental Health Act. Routine dental and other health appointments have stopped, and their access to urgent treatment may even discriminate against them. My Lords, when the economy and people's livelihoods were at risk, the government announced unprecedented financial support. And when more NHS capacity was needed, we built massive new hospitals across the country. But when vulnerable people saw their entire support network evaporate, the government's response was not to increase social care provision, but to watch it wither. My Lords, I speak from personal experience. and remind the House that I'm a carer for my adult disabled son who's at home with me during lockdown. 3 equally important areas: jobs, health, and supporting our most vulnerable people, but vastly different responses. This crisis adds urgent emphasis to the need for a properly funded national care service. I hope the Noble Lord the Minister will say something positive about a future funding settlement. It's needed, and it's needed soon. People with learning disabilities will need an increase in support to recover their confidence, meaningful occupation, and friendships when lockdown ends. I ask the Noble Lord the Minister, what will be done to reverse the harm done by the loss of familiar support during this period, which for many will have been complicated further by other traumatic losses? My noble friend Lady Masham spoke about the lack of recognition by the NHS of the respiratory risks faced by people with tetraplegia, like my youngest daughter. I share my noble friends and others' concerns too about difficulties recruiting to the care sector and our huge reliance on carers from Eastern Europe, who are finding it more difficult to come here to work. I look forward to hearing the Minister's response.
Baroness Brinton.
I declare my interest as the Vice Chair of the APPG for Social Care, and I thank Baroness Wheeler for securing this vital and highly pertinent debate, and also for the moving contributions from so many members of your Lordship's House. I also want to thank, on behalf of the Liberal Democrat benches, all the staff and volunteers working across the wider social care and community sector. Frequently low paid, but definitely not low skilled, these amazing people show us day after day their professionalism and their big hearts. Back in mid-February, we on these benches asked the Minister repeatedly about care. On the 26th of February, Lord Bethel said in Hansard, planning a massive communications campaign on how to protect people, particularly vulnerable people in our population, end quote. But the evidence of recent weeks shows that those most vulnerable in our communities and care homes have been seriously and tragically let down. Others have covered plenty of the detail, which is symptomatic of the centralised way that Whitehall, the Department of Health and Social Care, and the NHS have treated anything that isn't in hospitals as a second or even a third order of priority. Lord Shipley explained the problems that have arisen since Whitehall took over the supply chain for the social care sector, and then decided to create a separate system known as Clipper, which was due to come in line, we were told, on the 6th of April, but yesterday we discover is still 3 to 4 weeks away from going operational. And worse, where providers and local resilience forums have ordered their own PPE, it has been confiscated by government and rerouted centrally to hospitals first, leaving community settings high and dry. This includes lorries being stopped at border ports and drivers rerouted. Consequently, lack of PPE and policy moving patients from hospital into care homes without any testing has meant that COVID-19 has spread rapidly in the social care sector. I support Lady Jolly's call for clarity on DNRs and echo her concerns about GPs asking disabled people and learning disabled people completely inappropriate questions. It was very clear from the government advice, nice advice, and all good palliative care advice, that the way that this happened was inappropriate. And I do hope that as part of any inevitable public inquiry, this DNR factor will be examined. It seemed to happen in groups. Were CCGs asking GPs to ring their patients and find out if they wanted to go to hospital or not? To do it all in one conversation is completely inappropriate. And for many disabled people, it's just completely inappropriate to even ask them this. They have not got the clinical frailty that Lady Jolly spoke of. However, the government's lack of understanding of the wide range of other disabled people and extremely fragile ones living within our community extends completely in the opposite direction. The result of that has meant that people who have, say, for example, ventilators or tracheostomies have found that their care support is only entitled to the most simple and flimsy face masks because they're regarded exactly the same as the standard care in residential homes. The government's PPE for social care sector is almost always designed for the elderly. Matt Hancock said last week that health and social care workers should not overuse PPE. The gasp that went through the social care community when that was said could be heard across the country. Most community orders are receiving a tiny fraction of what is ordered and needed. And I think Baroness Barker summarised the problem between the department and local government well. Time and again, many noble lords have talked about testing. Testing itself in the social care sector has been a real problem, with very few sectors where staff can go and be tested. And the appalling story that came out on Sunday of a social care worker in Norfolk being asked to go to Sheffield, a 5-hour round trip to be tested, even their nearest place was 3 hours round trip away. It's all very well saying that more and more centres are opening up, but if they are all drive-through, many staff in the social care sector do not drive, and therefore it becomes impossible for them to get to them. I do hope that the Noble Lord the Minister will be able to explain to us when really accessible testing will be available for all social care staff who need it. The problems with PPE have demonstrated a perfect storm. At the beginning of this crisis, patients, elderly patients especially in hospitals, who may or may not have had COVID, were being pushed back into local care homes, but untested, whether they were symptomatic or asymptomatic. Staff in care homes were not able to access tests at that point at all. And as a result, COVID started rushing through many of our care homes. Many of the workforce already were either self-isolating or had to, because of symptoms, remove themselves completely from being able to work. And a criminal lack of PPE meant that COVID has had free rein. London estimates that 50% of care homes have active cases. Many noble lords have talked about the future of social care, and it's absolutely vital that we look at that in the context of today's debate. And Lady Northover set out the history of social care reform. I can remember the delight a decade ago when all three parties supported the Dilnot review, and the shock when the Conservative Party decided that it didn't want to continue with it. As we come to the end of this crisis, we must rapidly review the future of social care, but we must not start again from scratch. There is plenty of evidence to show what needs to be done, and our social care sector, already struggling before this crisis, has actually really struggled with cuts to local government and cuts to providers, with many providers having gone out of business and others hanging perilously by a thread at the moment. The consequences of all is so visible. The Rainbow Trust supports families with seriously ill children, and they have said that the risk of the COVID-19 pandemic has put the provision of social care by charities at a high risk of ceasing altogether, because many charities depend on fundraising, which has dropped significantly. In the short term, they say, it's unclear how government departments will divide up the modest funding package of 360 million for charities between so many charities desperately trying to provide for very, very vulnerable groups of adults and children. In the long term, they add, it's vital that sustainable funding is established to reduce the vulnerability of vital charitable social care to economic shocks, so that we do not end up in this position again. And they ask a question for the Minister, please, to go back to the Chancellor of the Exchequer. Many charities have had to furlough staff, but they've been allowed to work for other charities. In the medical sector, these staff have often got exceptionally specialist skills that cannot be used elsewhere. And as a result, some of the provision that they are trying to offer just cannot be done easily. My lords, Lord Campbell of Pittenweem rightly calls for a judge-led public inquiry. Too many things have clearly been going wrong. But we also need to recognise the contribution of our health and social care staff, wherever they are, in homes, in the community, in hospices. And that's why the Liberal Democrats say that we must have a proper package for them. They must have access to full and proper PPE. They need, for those tragically who die as a result of COVID in the line of service, proper death in service benefits. And we think that a daily allowance equivalent to the military deployment allowance should be paid during lockdown to people who end up putting themselves at risk. Too many do, and they are absolutely serving the nation.
Baroness Thornton.
My Lords, it is an honour to be winding up on behalf of the Labour benches this historic debate, the first substantial debate in our demi-virtual House. It's completely appropriate that social and domiciliary care are the subject for this debate for two reasons, my Lords. First, we could only suspect when my noble friend Baroness Wheeler proposed this debate how important would be our scrutiny of the effects of COVID-19 on care homes, on domiciliary care, on the 6.5 million carers in our community, and indeed on the elderly, those living with disabilities, both the old and the young, as mentioned by many of my noble friends, Lord Dubbs, Baroness Keithley, Lord Hunt, and Lord Neuberger. So, Lord Turnberg. Secondly, my noble friend framed this question for the debate in terms of both the short term and the long term. Because, my Lords, we must not lose sight of the importance of looking to the future as we fight the battles of today, as many noble Lords have said. Can I congratulate noble Lords on their contributions today? Can I congratulate them on the brevity and eloquence of their contributions, which were outstanding, and also on their command of the virtual world in which we now operate? And can I also thank the many organisations who have sent briefings to us and gently remind them that a briefing arriving yesterday will have less impact than one which we might have received a week ago. It is right to separate the short term, where we all wish to work together to mitigate the worst of this crisis, from the long term, where we learn lessons and address with honesty the inertia, the political cowardice, the long-term cuts, which have made it impossible to design and put in place a decent, modern, integrated care system. My noble friend Baroness Wheeler and I, the Labour team, have lost count of the number of times we have raised the inadequacies of the government's response to the stress being experienced on the front line in our social care system over the last 5 years. No green paper, inadequate budgets, huge cuts to council infrastructure. And it would be laughable, my Lords, if it were not so awful in its consequences for the most vulnerable in our communities in this pandemic. The fact that the First Minister yesterday did not know how many social care workers had lost their lives to COVID-19 during PMQs, I think tells us all we need to know about the priority the government has given social care over many years. That has to change, my Lords, it must change. Finding solutions means that issues are identified by good data, reported honestly and openly, and all those involved, from care homes, from trade associations, charities, trade unions, contribute to finding the solutions. The employment and the business solutions found by the Chancellor were a result of discussions with many different groups, particularly the CBI and the TUC. Why has that not been a model for social care during this pandemic? So will the noble Lord the Minister commit the government to bringing together all the stakeholders in this sector to discuss the future, not just the immediate issues of survival? Yesterday, my Lords, we learned that the current lockdown is unlikely to end anytime soon. The CMO tells us that the probability of lifting social isolation in the next calendar year are incredibly small. We should be realistic about that. We're going to have to rely on other social measures, which of course are very socially disruptive, as everyone is finding out right now. The Chief Medical Officer said that without a highly effective vaccine or a highly effective coronavirus, Britain will have to get used to this new way of life. And also, we don't know exactly what that means, partly because the government has chosen not to have a national conversation about the best way forward, but to inform us of their decision about ending lockdown at some time, but who knows when. What we do already know in the short, medium, and indeed the long term for the communities we're discussing today, the impact will be significant. So I beg the noble Lord the Minister not to talk to us in lofty terms about how hard he and the government are working, while we know this and we appreciate it, but instead to be honest about the challenge that we're facing as a nation and indeed in this sector, and have some discourse about solutions which are affected by with the communities affected. Perhaps ministers have had incorrect or incomplete information, but time and again, lofty promises and bold assertions have collided with reality. And this risks undermining trust in the government, which at the moment is so important. Those levels of trust influence our behaviour, and the lessons for our leaders, I think, are clear. Humility to admit they don't know everything, authentic in their narrative, empathy and reassurance for the anxious, clarity and consistency of messages from here, and above all, my lords, honesty. On the 9th of March, I asked the noble Lord the Minister the following question. My first question concerns vulnerable people in residential homes and the learning disabled who may be being supported either by charities or at home by their parents, and we need to include these people in the planning. My Lord's social care planning was published 5 or 6 weeks later, during which time COVID took hold in our care homes with a continuing devastating effect. And only in the last few days do we see testing being offered to residents and staff in these homes, for which, of course, we are grateful. And we are fortunate that the noble Lord the Minister is the Minister responsible for testing, which will now be rolled out. Clearly, testing centres which are miles away and can only be accessed by car are inappropriate for both residents and many staff. So when will testing that is accessible kick in? What is the time frame? And we have to be honest and say that reports have reached all of us of serious failures. Vulnerable people denied the care they were entitled to expect, some even, it has to be said, denied life itself. Many with disabilities have expressed how strongly they fear withdrawal or reduction in services vital to their well-being, mentioned by many noble lords. Not enough has been done to reassure them. In the short term, we see unprecedented actions. Care Act being effectively suspended with only protection of the HRA in place and the injection of literally billions into the care system. But it has to be said, my lords, nobody seems to know exactly where it will end up or whether it is enough. And the loss of hard-won rights in the field of adult care, as outlined by Baroness Tanny Gray-Thompson and indeed others, is a major concern. Service user groups, lawyers, advocacy groups are questioning whether the powers taken are in fact disproportionate to the extent of compromising human rights and are wondering after this period of emergency whether these rights will ever be returned. My lords, these are major concerns. And indeed, the rhetorical downplaying of the value of low skills and low pay has now been replaced by continuous heroes, as many have mentioned. And that really sets us the challenge for the future. It has proved to be hard in many places to set up proper systems to identify who is vulnerable, how they can be protected, and not fall through any cracks. Lack of good information and the absence of data sharing is exposed. Market mechanisms through contracts and regulation fail to embrace the ability to react in a major crisis. The deep-seated organisational barriers between the different sectors of care and between local authorities and NHS have been laid bare, my lords, despite heroic attempts in many places through local initiatives. We now see finally that there's been some recognition of how valuable care staff are, but this has to be matched by giving them the pay, conditions, training and equipment they need. Our current social care model does not work. Integration, despite laudable attempts in Manchester and some more imaginative SDPs, my own included, is really not going anywhere fast. The move to a national wellbeing strategy, avoiding all artificial barriers and tribalism in the NHS and between the NHS and social care is essential. Labour has set out its vision for a long-term solution. Like everyone else, we will study what we can learn from the crisis and adapt our policies as required. And we want to work across parties and across the nation, across all those groups. And we believe that work needs to start sooner rather than later. And as the NHS and social care must be seen as two sides of the same coin and supported in their efforts to respond to COVID-19 outbreak. It has never been more important to invest in this critical partnership. Social care providers and their staff have to adapt as the crisis evolves and new issues emerge, and are playing a key role in supporting vulnerable people at home and enabling people to return home with appropriate support. This pandemic has laid bare the challenges facing social care and highlights the urgent need for sustainable long-term funding solutions. This has to be a key priority for the government and the rest of us. In conclusion, I thank all noble lords for their contributions to this important debate. I heard a care home manager say on the television in despair last night, "We were not prepared and we are not being led," he said. She's right. This must change for the short term and the long term. Thank you.
Minister, Lord Bethell.
My Lords, I would also like to join the noble Baroness Wheeler and others in remembering those who have suffered from this dreadful disease, and pay tribute to those in healthcare and other key workers on the front line who selflessly and heroically help deal with this awful epidemic. And I have a personal reason to thank in particular those BME social care staff who take a particular risk and often take on the most challenging tasks. My Lords, I'd like to thank all noble lords for the thoughtfulness and the scrutiny they have brought to this digital debate, to an issue that is, as many have remarked, overlooked, but is now without doubt at the centre of our national debate. With 40 speakers and a whole lot of new technology to deal with, I apologise in advance if I cannot respond to all the thoughtfulness and perceptive questions that have been asked. But I will try to address the most immediate issues raised by noble lords with a practical update, and I will avoid the lofty, high-level stuff as requested by the noble Baroness Thornton. My Lords, as the Baroness Wheeler rightly stated, on the 15th of April, we published our action plan for adult social care. And this plan outlines how we have committed to strengthen and support this vital network for the carers and for the cared. This plan has 4 pillars. Firstly, our number 1 priority is to limit the spread of the infection. It is clear, as many noble lords have rightly raised, that the question of personal protective equipment has been an issue for many in the care sector. We recognise that, and we have set out a PPE plan on the 10th of April to deal with the issue. We recognise that PPE is vital to protect NHS and social care staff from contracting COVID and to protect the people that they care for. And we are acting to ensure PPE is available where it is needed. We're running hard at the procurement. The results are being felt, but there is more to be done. Public Health England have published guidance on good infection control practices, discharge processes, testing, and which scenarios to use PPE to minimise the risk of transmission. We have moved quickly to adapt guidelines to this new, complicated, and deadly threat. To be clear in the way we communicate, but I accept that it is sometimes difficult to keep up. I hear loud and clear from the noble Baroness Wheeler, Baroness Varma, and the noble Lord Hayne about the concerns on costs. And can I reassure this virtual chamber that substantial funds have already been mandated, the question of funding remains under review, and if more is needed, this government will step up to its responsibilities. We are taking these issues seriously, but the challenge is substantial. My Lords, this sector is largely made up of smaller independent providers that have historically sourced their PPE on open markets, as well put by the noble Lord Hayne. So we are putting in central procurement support at pace and on the fly. We've developed a parallel supply chain across government with NHS E&I, NHS Supply Chain, Clipper Logistics, and the Armed Services. The parallel supply chain has been established to support care homes, home care, and hospices. It is done in the spirit of collaboration, as the noble Lord Shipley has rightly recommended. This is already supplying PPE equipment to hospitals and the local resilience forums. And can I reassure noble lords that this improved speed and reliability of delivery is already relieving pressure on the supply chain. We are working around the clock to ensure staff on the front line can do their job safely. And as of the 20th of April, we've released 29 million items of PPE to 7 designated wholesalers for onward sale to social care providers. And this includes 11.4 million face masks, 13.3 million aprons, and 4.2 million gloves. My lords, let me say something on discharge. Moving someone from hospital to another area where infection control is important is incredibly delicate. We recognise that, and that's why last weekend the Chief Medical Officer changed the guidelines so that all patients will be tested before being admitted to care homes, as well as all care home residents. This is welcome news. On testing generally, can I reassure the noble Baroness Grey Thompson, and the noble Lord Hayne that while testing was initially limited to help manage the demand for tests for the most unwell, this has changed. There is new guidance and there is considerably more capacity. Can I reassure the noble Baronesses, Baroness Wheeler and Brinton, and the noble Lord Turnberg, that as lab capacity increases every day, we have already expanded testing to include more care home residents and care home staff. It is true that the drive-in centres were the quickest to set up, as the noble Lord Shipley rightly remarked. But can I reassure the noble Baronesses, Baroness Barker and the noble Lord Dubbs and others that we have started this week home delivery of self-administered packs, which will be organised by Amazon, pop-up mobile units that will be organised by the Army, and we hope to have a retail solution from Boots shortly. This will go a long way to address the concerns of those who find the drive-in centres awkward or unavailable. And on the subjects of counting deaths, can I reassure the noble Lord Billamoria and the other noble lords that the official ONS figures, which are informed by CQC returns from death certificates, will always capture COVID deaths, whether they are from hospitals, care homes or at home, and that it is a responsibility of doctors to inform PHE of any COVID death. My lords, the 1.45 million social care workers on the front line of the virus are crucial in delivering care to our most vulnerable citizens. So let me please say a word on those. Can I reassure the Baroness Grey Thompson that we have capacity for every care worker to be tested, just as there is for NHS staff and their families. PHE will be administering those tests and home testing equipment will be distributed. Social care workers have been designated as key workers, meaning the children of those working in social care can continue to attend school where there is no safe option for them to stay at home. In response to those who say government has done nothing, can I remind the noble Baroness Hollins and others that our action plan for adult social care sets out an ambition to attract 20,000 people into social care over the next 3 months. We will shortly launch a new national recruitment campaign to run across broadcast, digital and social media. The campaign will highlight the vital role that social care workforce is playing right now, during the pandemic, and along with a longer-term opportunity to work in care. And I am proud to recognise carers and to endorse social care branding with badges, lanyards, and to create a proper identity and recognition. We have formally introduced the Care brand to sit along the NHS brand in England. It is right that we recognise the hard work of carers and, as the noble Baroness Wheeler put it, to ensure that they too get support like queuing priorities when like their NHS colleagues. We recognise the immense pressure the social care workforce themselves may be facing, which is why we've extended a package of helplines and text-based systems across the board to support the well-being of carers and other frontline staff. Several noble lords, including the noble Baroness Finlay and the noble Lord Billamoria, raised the impact of BME staff working in the social care sector. We have commissioned work from Public Health England to understand the different factors that may influence the way someone is affected by this virus. My noble friend, Lord Astor, asked the important point about respite for carers. On the 8th of April, we published guidance for unpaid carers on gov.uk, which includes general advice, including advice on infection control, links to other information and support, and advice on caring where someone has symptoms. Can I reassure the noble Baroness Tyler, who asked about visa exemptions for nurses in social care, and Baroness Masham, who requested an update when we might relax the immigration rules to ensure we have an adequate number of carers, nurses and doctors. The government is already working with the NHS to ensure visas are extended to doctors, nurses and paramedics, and where, as noted by the noble Baroness Bull, there are significant numbers of overseas staff working on the front line to battle COVID. US Visa and Immigration has now written to 270 NHS organisations to begin processing these important extensions. And I would say the noble Baroness's valuable point that the social care workforce should be included within the scope of these discussions. My Lord, many employers across both health and adult social care benefit from the skills of overseas staff. However, my Lord, it is clear that international recruitment will not be straightforward at the moment, nor in the future, due to widespread travel restrictions in place around the world. And we are going to have to adapt to this new reality. Baroness Sherlock asked a very valid question on carers' eligibility for universal credit. We are acutely aware of the issues faced by the self-employed or those on 0 hours contracts. Some individuals employed on 0 hour contracts may be entitled to statutory sick pay. Those who are ineligible can claim universal credit or contributory employment and support allowance, depending on their circumstances. The third strand of our strategy is supporting independence, supporting people at the end of their lives and responding to individual needs. And I completely take on board by the comment by the noble Lord Blunkett on inadvertently creating a monster in our efforts to slay the dragon of COVID. But I would add that it is not the government that is seeking to punish older demographics and those with pre-existing conditions. It is the virus, and the objective of our policies are to save lives and to protect the NHS and our care services. We are working alongside technology firms, and let me give you a few examples. We are working alongside technology firms and voluntary organisations to assist the most at-risk and isolated people with access to vital emotional support and companionship. And these efforts are beginning to bear fruit. My Lords, whilst unnecessary visits are restricted, we are clear that visits at the end of life are important, both for the individual and their loved ones, and should continue. And the guidance now makes that clear. We recognise the specific challenges that disabled people will be facing as a result of COVID, as was raised by the noble Baroness Bull. We have been taking several important steps to mitigate the impact of COVID-19 on people with disabilities and continue to engage with stakeholders to ensure their needs are met. For instance, we are improving the accessibility of government guidance and are working with the Disability Unit, Public Health England and NHS England to ensure important messages are reached throughout the communities. My Lord, on the subject of PNR notices wrongly sent by some GPs, I totally endorse the comments of the noble Baroness Brinton, Jolly and Jones, the noble Lord Alton, and many others in their condemnation of preemptive DNR notices. It is a point that has been made very well by the CQC, and we all reject that practice. My Lords, the fourth strand of our strategy is protecting vulnerable children. The government understands the importance of having a robust social and domestic care provision for disabled and vulnerable children, and the need to ensure the sustainability of social care services, an issue that was raised by the noble Lord Farmer, the noble Baroness Massey, and the noble Lord Addington. We are taking action to ensure that those reliant on such services are identified and supported during the pandemic. Can I reassure the noble Baroness Massey that we are working closely with other government departments, local authorities and partners such as the Council for disabled children to assess the impact of COVID and local decisions on the provisions of these services. We know that some families need more support than others, and that attending education settings is an important protective factor. That is why we have not only ensured that they can continue attending school, but have made it clear that we expect them to, as long as it is safe for them to do so. We are also encouraging those families who have a child with SEND needs that can't be suitably supported at home to attend school also. But this will depend on a risk assessment. Many pupils with special needs are better off staying at home during the crisis. Lastly, we are supporting local authorities and the providers of care. In March, we announced £2.9 billion of funding to support and strengthen the care for the vulnerable. Local government is being supported by £1.6 billion of additional funding to meet extra demands. This funding can be used across all services facing pressure. Further, we have enhanced the NHS discharge process by providing £1.3 billion of funding to allow patients who no longer need urgent treatment to return home from hospitals safely and quickly. This funding will cover the follow-on care costs for adults in social care or people in need of additional support when they are out of hospital and back in their homes, community or care settings. We are keeping future funding under review. Can I reassure, we announced over the weekend a further £1.6 billion package to local government. This ensures that local government have the funding they need to respond to the crisis as it develops. A number of Noble Lords asked about VAT. Can I confirm to Noble Lords that providers pay VAT as private entities? But the important thing is that they have support with the costs they are incurring. And this is what we are doing through this significant funding. And can I remind Noble Lords that if adult care providers are charities, they don't have to pay. My noble friend, the Noble Lord, Baroness Varma, and my noble friend Lord Astor urged government to ring-fence this funding. We are taking important steps to ensure that this additional funding is making a difference. For example, as the Noble Lord, Lord Dodds has asked, we are asking local authorities to provide information about the distribution of this funding to providers. The government will continue to monitor pressures in the NHS and local government and will keep future funding under review. My noble lords, we are also supporting the system through emergency legislation. The Coronavirus Act 2020 came into force on the 31st of March, which brings significant changes to local authority duties under the Care Act 2014. Can I reassure my noble friend, the Lord Astor of Hever, that the government is committed to revoking these powers when they are no longer needed? Can I confirm to the noble Baroness Wheeler and Baroness Tanny Gray Thomas that we have received notification that 6 authorities are operating under the Care Act easements, and that I thoroughly support the publication of these details. Those authorities are Sunderland City Council, Middlesbrough, Warwickshire, Staffordshire County Council, Birmingham City Council and Solihull Council. The decisions local authorities may have to consider at this time are not simple, and it does not necessarily mean that they are in crisis. The Department of Health and Social Care has issued guidance on easements, including an ethical framework and a prioritisation guidance. Can I reassure Noble Lords, including the noble Baroness Wheeler, local authorities remain under a duty to meet needs where failure to do so would breach an individual's human rights under the European Convention on Human Rights. Such easement measures should only be used when absolutely necessary, based on local authority judgment of their ability to meet the needs of people in line with the Care Act. My Lord, the disease is a cruel enemy. It attacks the weak and vulnerable, as put very clearly by the noble Baroness Hollins. Carers and residents are put in a desperate position, not because of government policy, but because of the realities of this horrible killer. Can I touch on the comments of the noble Lord Alton on the matter of the final hours and funeral arrangements for those from care homes? As someone who has lost a loved one in a nursing home, I know at first hand that it is a heartbreaking reality of this awful epidemic that we cannot properly say goodbye to the ones we love. But can I just say a few words about the government's priorities? We have put this country on hold to save lives and to protect the NHS and our care service. The Noble Lord, Lord Tyree, made the financial commitment very, very clear. I reject the idea put by the Noble Lord, Lord Hunt, that this government treats those in our care homes as second-class citizens. They are a huge priority for everything we have done in the last months. Mitigating the impact of the COVID pandemic is the top priority of the British people and also of this government. My lords, this epidemic has undoubtedly put a spotlight on social care. The British people and this government will never look at social care in the same way again. Today, we are working flat out to mitigate the effects of the deadly disease. But things will change, my lords. The government has committed to a substantial review of the sector. It will come when the time is right. And as my noble lords have rightly asked, this review will be a moment for society to draw up a new contract with social care. It will need cross-party collaboration and a new approach. My lords, I would like to hold on to the feelings expressed in this debate and let us all remember these commitments to a fresh start when that moment comes.
Baroness Wheeler.
My lords, very briefly, can I thank all noble lords who've participated in this excellent and very powerful debate, and the noble lord the minister for his very thoughtful response. But however thoughtful, it's clear that many questions remain unanswered, and that we will need to ensure these continue to be brought to the fore and be dealt with by the government in future questions, statements, debates and legislation on this vital issue. Noble lords have stressed the need to be open and honest about the challenge on social care faces and the good and the bad news. I'm sure the noble lord the minister will take this message to heart. However, despite the challenges, I do want to stress that it's truly heartening to know that this terrible disease has at least been a wake-up call for the government and the public about the importance of adequate social care for millions of adults and children in need of it, and of the value, respect and decent pay that the 1.4 million staff must be given and deserve. I move the motion.
My lords, the question is that this motion be agreed to. As many as are of that opinion will say content.
Content.
The contrary, not content. The contents have it. And may I say, it's a privilege to be the first, I think, to utter those words in a virtual chamber. The virtual proceedings on this motion are now complete. My lords, the virtual proceedings will now adjourn until 4:30 p.m. when Lord Jermyn's topical question for short debate will begin.